Hello, my dear friend. A very warm welcome to all of you in this NEET PG PYQ series. Let's discuss with this entomology image first. So, which tick is this? Is this soft tick or hard tick? This, you can see the head is visible in this tick, and whenever the head is visible, H for head, H for hard tick. Second thing is, there are one other insect, Ixodid tick, which looks similar to it. And the other name of Ixodid tick is deer tick. So they are asking that out of these four diseases, which is transmitted by heart tick? And heart tick transmit, first of all, Cassiniure forest disease, which is also known as monkey disease, and then it transmit Rocky Mountain spotted fever. Anyway, Rocky means hard, and I used to think it like this, that Rocky is some adventurous guy who like to climb the mountain again and again, because the causative organism of Rocky Mountain spotted fever is Rickettsia rickettsii. So it is Rocky is climbing the mountain again and again, Rickettsia rickettsii. Other than that, the heart tick transmit all the disease with T, like Indian tick typhus. So again, you can remember it like this: Indian tick is hard tick, like that. Okay. Then there is tick fever, tick paralysis. So these are the disease by heart tick. And if they would be asking about Ixodid tick or deer tick, this Ixodid or deer tick, they transmit two disease. One is Lyme disease. In Lyme disease, you can get a picture with this type of lesion, target lesion. And second disease which Ixodid or deer tick transmit is babesiosis. In babesiosis, NEET 2018, they have asked this question, that there was a Maltese cross, purple color cross, peripheral smear, and they did not ask the disease, they asked who transmitted. So it was Ixodid tick or deer tick, which transmit Lyme disease, babesiosis. Heart tick transmit KFD, RMSF, tick typhus and all. So out of these 5-6 disease, only KFD is in the option. So that is the answer. Then can you identify this insect? This is the Imran Hasmi of insect kingdom. You can identify it with the pouting, है ना? This इतना ठरकी है ये कि ये पहले से ही पाउट किए हुए है, और अगर आपको पाउटिंग मिल रहा है तो ये है किसिंग बग, रेडोविड बग. और ये रेडोविड बग और किसिंग बग क्या ट्रांसमिट करता है? इट ट्रांसमिट वन डिजीज, छैगास डिजीज, छगास. इसको ऐसे भी याद कर सकते हो, रेडोविड बग झकास चुम्मा देता है ना? रेडोविड bug give very good kiss, and Chagas means very good kiss. So if you identify someone with pout, that is redovid bug coming out from the mouth, and it transmits Chagas disease. So this will be transmitting Chagas disease because that is redovid bug. चलो, अब ये एक इमेज बेस्ड क्वेश्चन आया था जिसमें वो पूछ रहे हैं कि किस बीमारी की लाइफ साइकिल दी हुई है, और यहां पर आपको एक माउस भी दिख रहा है. तो अगर माउस दिख रहा है तो क्या ये लेप्टोस्पाइरोसिस है? हो सकता है. अगर वो रैट यूरिन की बात करते तब ये लेप्टोस्पाइरोसिस होता, लेकिन वहां पर ये रैट यूरिन की बात नहीं कर रहे हैं, लाइफ साइकिल में रैट है. और यहां पर आपको ये जो मेरोजोइट दिख रहा है, ये मेरोजोइट में आपको एक क्रॉस दिख रहा होगा, यही है माल्टीज क्रॉस. तो ये किस डिजीज का लाइफ साइकिल है? ये लाइफ साइकिल है बैबेसोसिस का, जिसकी हम लोग अभी बात कर रहे थे कि बैबेसोसिस कौन फैलाता है. बैबेसोसिस ट्रांसमिट करता है इक्सोडिड टिक या डियर टिक. ओके. और बार बार सवाल लेप्टोस्पाइरोसिस से रिलेटेड आता है, क्योंकि लेप्टोस्पाइरोसिस केरला और मुंबई फ्लड में बहुत ही कॉमन डिजीज थी. जो सबसे कॉमन डिजीज थी वो लेप्टोस्पाइरोसिस थी. अब लेप्टोस्पायरोसिस के लिए केरला गवर्नमेंट ने जब फ्लड हुआ था तो एक तो डॉक्सीसाइक्लिन टैबलेट दी थी लोगों को बचाने के लिए, केमोप्रोफाइलैक्सिस के लिए। बट दूसरा सवाल ये आता है कि डॉक्सीसाइक्लिन के साथ और क्या बांटा गया था। तो कुछ ऐप आंसर लिखते हैं मैलेथियन बांटा गया था, बट मैलेथियन गलत आंसर है, क्योंकि मैलेथियन तो मच्छर को मारेगा और यहां पर हमें चाहिए रैट को मारने वाला रोडेंटिसाइड। रोडेंटिसाइड क्या है? जिंक फॉस्फाइड। तो इसलिए जब केरला फ्लड हुआ था तो जिंक फॉस्फाइड और डॉक्सीसाइक्लिन को डिस्ट्रीब्यूट किया गया था। दूसरा सवाल लास्ट नीट 2024 में आ चुका है कि अगर कोई पेशेंट है जिसको है काफ मसल पेन, काफ मसल तो आप समझ ही रहे हैं, और साथ के साथ काफ मसल पेन के साथ है फीवर, मैलेज, मैलेज मतलब बदन टूटेगा, है ना, और फिर कंजंक्टाइवल सफ्यूजन। कंजंक्टाइवल सफ्यूजन का मतलब होता है आंखों में लाल रंग आ जाना, लाल आंखें हो जाना। तो अगर कंजंक्टाइवल सफ्यूजन, काफ मसल पेन और फीवर मैलेज है तो वो लेप्टोस्पायरोसिस है। और लेप्टोस्पायरोसिस की वो लाइफ साइकिल INI-CET में भी पूछ चुके हैं। उसमें रैट यूरिन होगा जो फिर ह्यूमन फीकस के थ्रू और रैट यूरिन के थ्रू वो पूरी फ्लड के बाद होने वाली डिजीज कॉमनली हो जाती है। इसलिए याद रखना, अगर लाइफ साइकिल में रैट यूरिन है तो आप जाएंगे लेप्टोस्पायरोसिस की ओर, लेकिन अगर रैट के साथ वो ऐसा बैबेसियोसिस जैसा माल्टीज क्रॉस दे दिया तो ये किसकी लाइफ साइकिल है? ये लाइफ साइकिल होगी बैबेसियोसिस की। ओके। इसके अलावा आप अगर इंटमोलॉजी को, क्योंकि माइक्रो PSM दोनों में सवाल आता है तो बहुत इंपॉर्टेंट एरिया हो जाता है, अगर उसको समराइज करना चाहते हैं तो आपको बस 3 निमोनिक इस पूरे को समराइज करेगी। एक तो है पर्ट जो लाउज फैलाता है। पर्ट से 4 डिजीज हो गई, पी से कौन सी डिजीज हो गई? पेडिकुलोसिस। और बार बार सवाल आता है कि इपीडेमिक टाइफस के बारे में। ओके, तो ये है ई से इपीडेमिक टाइफस, जो जू फैलाएगा वो है इपीडेमिक टाइफस। और हमारे घरों के अंदर रहता है चूहा, और चूहे के ऊपर रैट फ्लिया रहता है। तो अगर रैट फ्लिया की बात होगी तो रैट फ्लिया के लिए जो निमोनिक है जिससे आप याद कर सकते हैं वो ये है कि रैट फ्लिया, जिसका साइंटिफिक नेम जेनोफाइसीलिया चियोपिस है, उसके ऊपर आप मान लो छोटा भीम को बैठा हुआ गधे के साथ, और वहां उसका निमोनिक हो जाएगा भेम, BHEM, भेम। तो रैट फ्लिया जिसका निमोनिक भेम होगा वो 3 डिजीज फैलाएगा। बी से हो गया बुबोनिक प्लेग। बुब्बो मतलब क्या होता है? बुब्बो मतलब लिम्फ नोड। और जब भी प्लेग होता है तो प्लेग सबसे पहले लिम्फ नोड में जाता है, बुबोनिक प्लेग करता है, फिर लंग में आता है, निमोनिक प्लेग करता है, और फिर ब्लड में जाके सेप्टिसेमिक प्लेग करता है। तो ये हो गया बी से बुबोनिक प्लेग। एच से है हाइमेनोलेप्सिस, और ई से है इंडेमिक टाइफस, और इंडेमिक टाइफस का ही दूसरा नाम है म्यूरिन टाइफस। तो ये 4 डिजीज भेम से याद हो सकती है, बुबोनिक प्लेग, हाइमेनोलेप्सिस, इंडेमिक टाइफस, म्यूरिन टाइफस। अब इसके निमोनिक में छोटा भीम मैंने क्यों बनाया? क्योंकि जैसे छोटा भीम हमारा लोकल हीरो है, इंडेमिक है, इंडिया में का हीरो है, छोटा भीम है ना, वैसे ही इंडेमिक टाइफस भी इंडेमिक है, इंडिया का है, इंडेमिक है। ओके। और इंडिया में आपको भी पता है कि एक इंडिया में टाइफॉइड बहुत कॉमन है। तो इंडेमिक टाइफस को कौन कॉज करता है? इसको कॉज करता है रिकेटेशिया टाइफाई। क्योंकि एग्जाम प्रेशर में हम लोग इपीडेमिक और इंडेमिक टाइफस में कंफ्यूज हो जाते हैं। तो इसको आप ऐसे याद कर सकते हो कि इपीडेमिक बालों से हो गया, बाहर है, तो इपीडेमिक टाइफस लाउज जो सर पे जू है वो फैला रहा है, और इपीडेमिक टाइफस का पॉजिटिव ऑर्गेनिज्म है रिकेटेशिया प्रोवाजाकी। बहुत पावर है ना, प्रोवाजाकी। और इंडेमिक टाइफस जो हमारे घरों के अंदर रहने वाला चूहा है, उसके ऊपर रहने वाला रैट फ्लिया से फैलेगा। तो रैट फ्लिया इंडेमिक टाइफस करेगा। उसका पॉजिटिव ऑर्गेनिज्म है हमारे इंडिया में ही होने वाला टाइफॉइड, बहुत कॉमन से रिकेटेशिया टाइफाई, और इपिडेमिक टाइफस है रिकेटेशिया प्रोवाजाकी से। तो कभी कभी वो इसको एक क्लिनिकल पिक्चर की तरह 2 बार पूछ चुके हैं कि अगर एक इंसान को बाइट हुई और बाइट होने के बाद, बाइट बाय इंसेक्ट होता है ऑफ कोर्स, और इंसेक्ट बाइट होने के बाद इसको फीवर और रैश हो रहे हैं, तो ये कौन सी डिजीज है? तो मोस्टली अगर ह्यूमन बाइट के बाद फीवर रैश की बात करते हैं तो वो मोस्टली आपसे इपिडेमिक टाइफस पूछ रहे होते हैं। और लाउज, जिसका निमोनिक मैंने पर्ट बता रहा था, उसमें 4 बीमारी कौन कौन से है? पी से पेडिकुलोसिस, ई से इपिडेमिक टाइफस, आर से होता है रिलैप्सिंग फीवर, और टी से होता है ट्रेंच फीवर। ट्रेंच फीवर से कई बार वो सवाल पूछते हैं कि क्विंटाना फीवर कौन फैलाता है। तो एक बड़ा ही कॉमन क्वेश्चन है क्यू फीवर के बारे में, जो हमारे टाइम में बहुत ज्यादा आया करता था। क्यू फीवर को मेनली एयर फैलाती है, लेकिन क्विंटाना फीवर ट्रेंच फीवर का दूसरा नाम है। क्यों? क्योंकि ट्रेंच फीवर का पॉजिटिव ऑर्गेनिज्म है बार्टोनीला क्विंटाना, इसलिए ट्रेंच फीवर को हम लोग कहते हैं क्विंटाना फीवर या क्विंटेनियाक फीवर। तो यहां पर पहले आप याद कर लो लाउज को, फिर याद कर लो रैट फ्लिया को। लाउज आपको भी याद होगा, बचपन में जब आप सर से निकाल के मारते थे तो क्या आवाज आता था? पट। तो इसलिए लाउज का निमोनिक है, जू का निमोनिक है पट। पेडिकुलोसिस, इपिडेमिक टाइफस बाय प्रोवाजाकी, रिलैप्सिंग फीवर और ट्रेंच फीवर। दूसरा मैंने बताया रैट फ्लिया में भेम याद कर सकते हैं बड़ा आसानी से, उसके ऊपर भीम बैठा हुआ है। बुबोनिक प्लेग, हाइमेनोलेप्सिस, इंडेमिक टाइफस जो रिकेटेशिया टाइफाई से होगा, और उसी का दूसरा नाम है म्यूरिन टाइफस। और एक आखिरी निमोनिक जो आपको इस पूरे पार्ट को याद करने में बहुत हेल्प करेगा, वो है आरएसएस। इसी को जब मैं एमबीबीएस में था तो मैं इसको ऐसे याद करता था, पीएसएम सड़ा हुआ। ये डिजीज जो है, एम से क्या हो गया? माइट, पी से क्या हो गया? रिकेटेशियल पॉक्स, एस से है स्क्रब टाइफस, और दूसरे एस से होगा स्केबीज। तो अब आप बोलोगे कि सर मालवाल फूक के आए हो क्या? पी से कैसे रिकेटेशियल पॉक्स हुआ? वो तो आर से हुआ। आई नो रिकेटेशियल पॉक्स आर से है, लेकिन आर से फिर रिलैप्सिंग फीवर भी है। तो एमबीबीएस में मैं कंफ्यूज होता था, इसलिए मैं उसको पी से याद किया, एस से स्क्रब टाइफस, एस से स्केबीज, एम से माइट। बट फिर जब मैं एक जगह क्लास ले रहा था तो डॉक्टर अनिल थे, उन्होंने मुझे सजेशन दिया कि सर पीएसएसएम की जगह हम आरएसएस भी याद कर सकते हैं। आर से रिकेटेशियल पॉक्स, एस से स्क्रब टाइफस, और लास्ट एस से हो गया स्केबीज। तो मैंने बोला क्यों नहीं, बिल्कुल याद कर सकते हैं। तो अब ये आपके ऊपर है, आप चाहे आरएसएस को माइट मानो, चाहे पीएसएम को माइट मानो, बट याद ये रखना कि 3 बीमारी कौन कौन से हैं माइट से होने वाली? रिकेटेशियल पॉक्स, स्क्रब टाइफस और स्केबीज। और स्क्रब टाइफस के ऊपर पिछले बार नीट में एक बड़ा इंटरेस्टिंग क्वेश्चन आया। उन्होंने एक इमेज दिया जिसमें इसार बना हुआ था। इसार क्या होता है कि चारों तरफ तो व्हाइट होगा, बीच में ऐसे लाल रंग का होगा, है ना, रेडनेस, और रेड ब्लैक कलर बीच में होगा, और फिर ब्लैक कलर के चारों ओर थोड़ी सी रेडनेस होगी, फिर व्हाइट या ब्लैक स्किन होगी। तो ये इसार फॉर्मेशन अगर आपको मिलेगा तो वो स्क्रब टाइफस से होता है। और स्क्रब टाइफस इपिडेमिक टाइफस के बाद पूछा जाने वाला सेकंड मोस्ट कॉमन है। तो इसमें क्लिनिकल मैनिफेस्टेशन में इसार मिलेगा, और इसका पॉजिटिव ऑर्गेनिज्म कौन है? रिकेटेशिया टुच्छु टुच्छु गाम्बूसी। तो इसको याद कर सकते हो, टिश्यू टुच्छु टुच्छु गाम्बूसी या सुसु गाम्बूसी के नाम से। और इसको ऑफ कोर्स माइट फैलाता है, बट एक स्पेशल टाइप का माइट फैलाता है जिसका नाम है ट्रॉम्बिकुलिड माइट। ओके, जिस तरह से स्केबीज को माइट फैलाता जरूर है, लेकिन एक स्पेशल टाइप का माइट फैलाता है, इच माइट, सार्कोपिटस स्केबीज। उसी तरह से स्क्रब टाइफस को भी एक अलग टाइप का माइट फैलाता है, कौन है? ट्रॉम्बिकुलिड माइट। तो अगर आपको ये 3 निमोनिक और हार्ट टिक के जो ट्रांसमिटेड डिजीजेस हैं वो याद रहेंगे, तो आप एंटोमोलॉजी के 90% क्वेश्चंस को बिल्कुल आराम से बना सकते हैं। और आई होप आप ये याद रखोगे। इन डिजीज को और इनके कॉस्टिव ऑर्गेनिज्म को। चलो इसके बीच में एक और बात कभी कभी वो दे देते हैं कि वो आपको फरो फॉर्मेशन देते हैं कि वो ट्रैक बना है। सार्कोपिटस स्केबीज आपको पता है स्किन के नीचे होता है, तो उसके ट्रैक का फोटो दे देंगे, या हिस्ट्री दे देंगे कि फैमिली मेंबर को भी इचिंग है, या हिस्ट्री दे देंगे कि इनग्वाइनल एरिया या ये बगलों में यानी आर्मपिट में इचिंग है। तो इचिंग इन आर्मपिट और इनग्वाइनल एरिया, इचिंग इन फैमिली मेंबर और बर्रो फॉर्मेशन, दीज ऑल विल इंडिकेट टुवर्ड्स स्केबीज। और ऑफ कोर्स स्केबीज की ड्रग ऑफ चॉइस क्या है? परमिथ्रिन। तो आपको माइट जिसका निमोनिकारेसिस पीएसएम है, लाउज जो पट, रैट फ्लिया जिसका भेम है, और हार्ट टिक जिसका जैसा दिखता है इक्सोडिक टिक और डियर टिक। अगर ये पार्ट याद हैं तो आप इंटमोलॉजी जो माइक्रो पीएसएम दोनों में आता है उसको कॉन्फिडेंटली मोस्टली आंसर कर सकते हैं। चलो अब इंटमोलॉजी को रिवाइज करने के बाद हम आते हैं पेरिफेरल स्मीयर्स को देखते हैं। इस पेरिफेरल स्मीयर में ये पूछा है कि ये किसका गैमेटोसाइट है। क्या ये गैमेटोसाइट वाइवेक्स का है या फैल्सीपेरम का है? ओवेल का गैमेटोसाइट तो एग्जाम में आएगा नहीं, क्योंकि ओवेल और फैल्सीपेरम जनरली अफ्रीकन एरिया में होता है। जब वो फैल्सीपेरम के गैमेटोसाइट देंगे तो उन गैमेटोसाइट में या तो बनाना शेप्ड गैमेटोसाइट होगा आरबीसी के अंदर, या तो हेडफोन शेप्ड अपीयरेंस होगा, तो फैल्सीपेरम है। और जब वो वाइवेक्स की गैमेटोसाइट देंगे तो वाइवेक्स के गैमेटोसाइट में एक एरिया में न्यूक्लियस होगा और फिर वो ग्रैन्यूल्स होंगे बहुत सारे। तो अगर ग्रैन्युलेटेड आरबीसी है तो वाइवेक्स है। और यहां पर आप पेरिफेरल स्मीयर में क्या इस गैमेटोसाइट में ग्रैन्यूल्स देख पा रहे हैं? बिल्कुल, ये मल्टीपल ग्रैन्यूल्स हैं यहां पर, तो इसीलिए ये गैमेटोसाइट वाइवेक्स का है। ओके, दिस इज वाइवेक्स गैमेटोसाइट। दूसरी बात, वो कभी कभी इसको दूसरे एंगल से पूछते हैं कि ऑफ कोर्स मलेरिया के केस डिटेक्शन के लिए मल्टीपर्पस वर्कर, जिसको हम लोग हेल्थ वर्कर मेल कहते हैं, वो 14 दिन में एक बार गांव में विजिट करता है और 2 ब्लड स्मीयर बनाता है। सवाल यह आता है कि स्पेसीज का पता किस स्मीयर से पता चलेगा, थिन से या थिक से? तो जब ये एक्टिव सर्विलेंस कर रहा है, एक्टिव सर्विलेंस का मतलब समझते हैं कि हम घर घर घूम करके या हेल्थ सिस्टम के लोग घर घर घूम करके छुपे हुए केस को पता लगाते हैं, तो उसको कहते हैं एक्टिव सर्विलेंस। तो इस एक्टिव सर्विलेंस के दौरान वो 2 स्मीयर बनाता है और थिन स्मीयर से पता चलता है कि वो स्पेसीज कौन सी है, क्या वो फैल्सीपेरम है या वाइवेक्स है। और इसमें जो गोल्ड स्टैंडर्ड स्टेनिंग होती है वो है गायमजा स्टेनिंग। ये भी सवाल आया हुआ है। तो गायमजा स्टेनिंग से इसका पता चलेगा स्पेसीज का, और स्पेसीज में आप इजिली गैमेटोसाइट देख के आइडेंटिफाई कर लेंगे कि वो फैल्सीपेरम है, वाइवेक्स है। एक और सवाल नीट में आया हुआ है कि अगर हम हिस्टिडिन रिच प्रोटीन है आरडीटी किट में, आरडीटी यानी रैपिड डायग्नोस्टिक टेस्ट किट, तो रैपिड डायग्नोस्टिक टेस्ट किट में हिस्टिडिन रिच प्रोटीन है, तो क्या ये हिस्टिडिन रिच प्रोटीन फैल्सीपेरम को इंडिकेट करेगा या वाइवेक्स को या दोनों को? तो एच से होता है हिस्टिडिन और एच से ही होता है हिस्ट्री। और आपको पता है कि जब भी फैल्सीपेरम इन्फेक्शन होगा तो पेशेंट को सेरिब्रल मलेरिया, रीनल मलेरिया हो सकता है, पेशेंट मर भी सकता है और मर के हिस्ट्री बन सकता है। तो हिस्टिडिन रिच किट, रिच प्रोटीन आरडीटी किट, ये वाइवेक्स का पता नहीं लगाएगा, केवल फैल्सीपेरम का पता लगाएगा। ओके, फैल्सीपेरम और वाइवेक्स अगर दोनों का पता लगाना है तो हम लोग जिस किट को यूज करते हैं उसको कहते हैं ऑप्टिमल किट, और उसमें लैक्टेट डिहाइड्रोजिनेज एंजाइम होता है। बट हिस्टिडिन रिच किट, एच से हिस्ट्री विच इज ड्यू टू फैल्सीपेरम इन्फेक्शन, तो हिस्टिडिन रिच किट केवल फैल्सीपेरम को मेनली डिटेक्ट करेगा। चलो अब दूसरे इंटमोलॉजी में सवाल आते हैं मॉस्क्यूटो से रिलेटेड। और क्या आप ये आइडेंटिफाई कर सकते हैं ये कौन सा मॉस्क्यूटो है? क्या ये मनसोनाई है, क्यूलेक्स है, एडिस है या एनोफिलस है? तो यहां पर आप 3 बातें देख पा रहे हो। एक तो ये कि इस मॉस्क्यूटो को जब ये बैठा है तो इसका हम्प बन रहा है, बम नहीं, हम्प। दूसरी बात, इसके बम जो हैं वो गोल्डन ब्राउन कलर के हैं। और तीसरी बात, इसका बैक जो है उस पे बाल हैं, हेयरी बैक। तो ये तीनों बात क्यूलेक्स के साथ होती है। क्यूलेक्स का होता है हेयरी बैक, गोल्डन ब्राउन बम और हम्प, है ना, ये है ना, इसके बैक में हेयर होंगे। ये हमारे इंसेक्ट किंगडम का अनिल कपूर है। क्यूलेक्स को आइडेंटिफाई आप बहुत आसानी से कर लेंगे, आई होप। अब दूसरा पॉइंट वो ये पूछते हैं कि किस मॉस्क्यूटो का होता है स्पॉटेड विंग। अगर आप आंसर जानते हो तो बताओ कि स्पॉटेड विंग किसका होगा। क्या ये आंसर है एनोफिलस या इसका आंसर है एडीज? चलो बताओ किसमें होते हैं स्पॉटेड विंग। आई विल बी लुकिंग एट द चैट बॉक्स। बताना प्लीज कि किसमें है स्पॉटेड विंग। और फिर दूसरा सवाल आते हैं इनसे ट्रांसमिट होने वाली डिजीज का, जो फिर अगेन माइक्रो पीएसएम दोनों में आ सकता है। तो क्यूलेक्स आपको पता ही होगा कि जापानीज इंसेफेलाइटिस फैलाता है, फिलारियासिस फैलाता है, और तीसरी डिजीज जो फैलाता है वो है वेस्ट नाइल फीवर। ओके, और एडिस 5 बीमारी फैलाता है। कौन कौन सी? चिकनगुनिया, डेंगी, येलो फीवर, जिका वायरस फीवर और रिफ्ट वैली फीवर। तो इन दोनों के बीच में मैं हमेशा कंफ्यूज होता था एमबीबीएस के टाइम में, पीजी के टाइम में भी थोड़ा बहुत, कि रिफ्ट वैली एडिस फैलाएगा और वेस्ट नाइल फैलाएगा क्यूलेक्स। तो इन दोनों में कंफ्यूजन एग्जाम प्रेशर में ना हो, इसके लिए एक स्टूडेंट थी, उन्होंने मुझे बड़ा अच्छा सजेशन दिया कि ये सर हमेशा याद होगा, बस इतना समझना है हमें कि क्यूलेक्स तो आप सब जानते हैं गंदे पानी में भी ब्रीड कर सकता है, इसलिए इसको कहते हैं न्यूसेंस मॉस्क्यूटो, है ना। जब इसको ठरक मस्ती है सेक्स करने की, तो ये नहीं देखता है कि पानी क्लीन है या डर्टी है, डर्टी पानी में ब्रीड कर देता है। तो क्यूलेक्स क्योंकि डर्टी पानी में ब्रीड करता है, इसलिए इसको न्यूसेंस कहते हैं, कचरा मॉस्क्यूटो कहते हैं। और वेस्ट नाइल फीवर को आप वेस्ट नाली की तरह याद कर सकते हो, क्योंकि क्यूलेक्स नाली में, सीवेज वाटर में, टट्टी वाले पानी में ब्रीड कर सकता है। तो क्यूलेक्स से कौन सी बीमारी फैल रही है? वेस्ट नाइल फीवर। ओके, और एडिस से होगी रिफ्ट वैली फीवर। प्लस एक बात ये भी याद रखना कि जिक्का वायरस, जो जेड से मैंने लिखा है ना, जिक्का वायरस, इसमें 2 प्रॉब्लम होती है। एक तो होता है गुलियन बारे सिंड्रोम, जीबी सिंड्रोम। दूसरी प्रॉब्लम जिक्का वायरस में क्या होती है कि मान लो मेरी जैसी कोई प्रेग्नेंट लेडी है और प्रेगनेंसी में उसको जिक्का वायरस हो जाए, तो क्या होगा? अगर मुझे प्रेगनेंसी में जिक्का इंफेक्शन होगा तो मेरे लॉन्डे की होगी छोटी मुंडी, यानी माइक्रोसिफेली इन न्यूबॉर्न। ये भी जिक्का वायरस इंफेक्शन का एक कॉम्प्लिकेशन है, माइक्रोसिफेली इन नियोनेट और न्यूबॉर्न चाइल्ड। ओके, अब स्पॉटेड विंग किस में होता है भाई? एनोफिलस में होगा या एडिस में? वेरी गुड मिस्टर फूडी, ऋषभदास, रितंबर स्वामी, मुकेश सिंह, मिश्रा, अर्पित और अच्चन खान, आप सबने सही जवाब दिया। एनोफिलस, एनोफिलस बिकॉज इट ब्रीड इन क्लीन वाटर, सो वी कॉल एनोफिलस एज sophisticated mosquito, and sophisticated mosquito Anopheles have spotted wing. Aedes have black white stripes over body, but Aedes don't have any spot on the wing. So Aedes do not have a spotted wing, it is in the Anopheles. So I hope you will remember these illnesses and all. Plus sometime they ask the 3 type of malaria. One is urban malaria. Urban malaria is by Anopheles stephensi. And when they try to make the paper a bit complicated, then they can go to this part, ki which Anopheles is causing urban malaria, which Anopheles is causing rural malaria, that is Kalki faciens, and which Anopheles is causing forest or hilly malaria, that is Anopheles fluviatilis. So again, it is so easy to remember. One of my friend, Dr. Ankur Jain, with which I used to do this Chote Miya Bade Miya episode, he gave me this mnemonic that, see, fancy or fashionable people or fashion things are mostly in urban area. So urban, fancy. And then I used to think that calcium, milk, cow, buffalo, they are more in rural area. So Kulki faciens is causing rural malaria, calcium, milk and all this rural area more, so rural malaria. And where will you find flowers and all? Flowers will be more in forest and hilly area. So fluvialis will cause forest or hilly malaria. Okay. So these are the three type of malaria transmitted by Anopheles. Very easy to remember. Stephensi urban, calcium rural, fluvialis forest hilly. Okay. Chalo. So do remember that the previous mosquito which has hair on the back, golden brown bum and hump, that was Culex, and Culex is known as nuisance mosquito. But we should also know about Mansonii. Mansonii, if you will look at the image of Mansonii on Google, it's a black color, very differently looking mosquito. Mansonii looks similar to rat flea actually. Rat flea is brown color, Mansonii is black color, and it's a very unique, different type of mosquito which breed also in a very different area. Where do Mansonii breed? Mansonii breed in root of aquatic plant. Okay. And which disease does Mansonii transmit? Mansonii transmit only one disease, that is Brugian filariasis. Okay. So do remember all the four mosquitoes being asked again and again. Plus then they can ask the question from the larva also. Remember, if it is larva of Anopheles, Anopheles larva do not have breathing tube. So it cannot hang from water surface. If it is Anopheles larva, it will float parallel to water surface. Okay, and the water will be clean. So if you found larva floating parallel to water, not hanging from it, that is Anopheles larva. Chalo, the next question is that there was a large study done on serum cholesterol level in patient with diabetes mellitus, and it tell that the blood sugar level, the serum cholesterol level is normally distributed. Mean serum cholesterol is 230. Standard deviation is 10. So they have given mean and standard deviation. Now they are asking 68% of patient will have serum cholesterol between which level. So they are asking about 68% confidence interval. So can you calculate and tell me out of ABCD which will tell about 68% confidence interval? The formula I hope you all know. When it is 68%, the formula is mean plus minus 1 into standard deviation. And of course, if it is 95%, then the formula is mean plus minus 2 standard deviation. So here 68% asked, mean value was 230, standard deviation was 10. So if you do 230 plus minus 10, it will be 220 to 240, which is 68% confidence interval. But in the same question, if they ask 95% confidence interval, 95 is mean plus minus 2 standard deviation, that means 230 plus minus 2 into 10, 20, that means it will be 210 to 250. This is 95%. So before answering, be careful whether they're asking 68 or 95%. It's a very common numerical. So don't do mistake in such simple numerical and don't leave such question. Now the next question is, they are asking about case fatality rate of TB. And they have given that there was 5 deaths due to TB. And how many there were cases of TB? Cases of TB was 100. 100 people have pulmonary TB. So can you find the case fatality rate they are asking? And it's very simple to remember the formula of case fatality rate. Fatality matlab death. So when we write the formula of case fatality rate, we write case above, case below, fatality above. Okay. नीचे लिखते हैं कि कितने लोग मर गए इस बीमारी से. Fatality due to specific disease like here we are talking about TB. So कितने लोग मरे टीबी की वजह से वो नीचे लिखते हैं. How many died due to TB we write below. And we write cases of TB above, cases of specific disease above. So how much? Oh, I was writing the formula earlier, correct? When we write case fatality rate, I'm really sorry for this confusion. In the case fatality rate, the denominator is how many case of TB is there. And numerator is out of the total case of TB, how many fatality or death occur due to specific disease. So death due to TB or specific disease we write as numerator, and case of that disease we write as denominator, and then we multiply it by 100. Okay, तो इतना मुश्किल नहीं है याद करना. केस फैटालिटी, केस नीचे, फैटालिटी ऊपर. And in this case, in this story, how many died due to TB? 5 died due to TB. So we write 5 above. How many are the cases of TB? 100 were cases of TB. So 100 will cancel out, and finally case fatality rate will come out to be 5% or 5. और केस फैटालिटी रेट हमें क्या बताता है? केस फैटालिटी रेट हमें बताता है किलिंग पावर, वायरुलेंस ऑफ डिजीज, कि टोटल अगर 100 मरीज होंगे तो उसमें से कितने मरेंगे. इट टेल्स दैट आउट ऑफ 100 पेशेंट हाउ मेनी डाई ड्यू टू टीबी. सो केस फैटालिटी रेट टेल किलिंग पावर और वायरुलेंस, कि मारने की इस बीमारी की ताकत कितनी है. इट टेल्स अबाउट किलिंग पावर और वायरुलेंस ऑफ दैट डिजीज which we are talking about. Okay, very good. Pratyusha, Aki, Mishra, Arpit, Mass, all of you, and Pankaj Tiwari, all of you were right. Answer is 5% or 5, because 5 were the death, 100 were cases, and 5 by 100 into 100 it will come 5. But there is two more type of death rate which we have to remember. One is proportional mortality rate. ध्यान से इन तीनों के फॉर्मूले को बस आप याद कर लें. अगर ये फॉर्मूला बस याद हो गया तो इस टॉपिक के न्यूमेरिकल आसानी से बनेंगे, और ये बार बार आते भी हैं. पहला है हमारा जो हमने अभी अभी पढ़ा, किसका फॉर्मूला? केस फैटालिटी रेट का. दूसरा, फर्स्ट फॉर्मूला इज ऑफ केस फैटालिटी रेट. सेकंड फॉर्मूला इज ऑफ प्रोपोर्शनल मोर्टालिटी रेट. थर्ड इज स्पेसिफिक मोर्टालिटी रेट. ओके, तो देखो बिडू, गुड न्यूज क्या है कि इन ऑल दिस थ्री न्यूमरेटर इज सेम. तीनों में एक ही न्यूमरेटर है. क्या न्यूमरेटर है? न्यूमरेटर है डेथ ड्यू टू स्पेसिफिक डिजीज, जिसके बारे में क्वेश्चन में पूछ रहा होगा. डेथ ड्यू टू दैट स्पेसिफिक डिजीज about which they are asking in the question. Like in the last question, they were asking about TB. So numerator is same, death due to specific disease. Yahan bhi in proportional also same numerator, in specific also we have same numerator. The difference is only in the denominator. Case fatality rate में denominator होगा case. Proportional mortality rate में denominator is total death. Total death, not death due to TB only, but total death. And specific mortality rate will have denominator of total population. And because in NEET exam also nowadays they are giving 4-5 numerical, so I am expecting in this NEET exam one numerical can definitely be from either case or proportional or specific mortality rate. So focus here, it's very simple. Only denominator you have to remember. Case, death, population. Multiplication factor is 100 here, 100 here. But in the specific mortality rate, because denominator is total population, big denominator, so we multiply by 1000. And numerator is always same, death due to specific disease. So how will you remember the three formula? You can remember it together. Case, proportional, specific. Case, death, population. 100, 100,000. And like that you can remember all the three and revise them easily. Now, what does proportional mortality rate tell about? Proportional mortality rate ये बताता है कि जो सारी मौतें हुई हैं उसमें से किस बीमारी का बर्डन या बोझ सबसे ज्यादा है. सभी मौतों में से कितनी मौत इस बीमारी से हुई है. सो प्रोपोर्शनल मोर्टालिटी रेट इज टेलिंग अस बर्डन ऑफ डिजीज आउट ऑफ टोटल डेथ. बर्डन ऑफ डिजीज आउट ऑफ टोटल डेथ. फॉर एग्जाम्पल, in our question, which disease we were talking about? Tuberculosis. And how many were the death due to TB? 5. What was the total death in our question? You can see total death was 10. 10 people total died. So denominator you will put 10 and proportional mortality rate will come out to be 50%. That means इस गांव में 10 लोगों में से आधी जनता 5 लोग टीबी से मरे, तो टीबी का बर्डन कितना था? 50% था. Okay, that means in this population, in this village, out of 10, 5 died due to TB. So what was the burden of TB out of total death? 50%. So this is proportional mortality rate. अब specific mortality rate कितना निकल के आएगा? How many died due to TB? 5. So again, numerator is 5 in all these cases, in all this 3 formula. But what was the total population of our village? Total population of our village was 1 lakh. So we will put 1 lakh as denominator. And if you put 1 lakh as denominator, this 30 will cancel out. 5 by 100 means 0.05. This is the specific mortality rate. Or specific mortality rate tells about high risk population for death. That which disease patient are at high risk for death. Okay? तो आओ इन तीनों फॉर्मूले को और इन तीनों फॉर्मूले के मीनिंग को एक बार रिवाइज करते हैं. केस फैटालिटी रेट बताता है कि बीमारी का मारने का पावर कितना है. जैसे रेबीज का केस फैटालिटी रेट होता है 100%, क्योंकि इसका मतलब हुआ अगर 100 केस हुए तो 100 मरेंगे. तो केस फैटालिटी रेट टेल्स अबाउट किलिंग पावर और वायलेंस. फॉर एग्जांपल इन रेबीज इट इज 100%, दैट मींस इफ इट इज 100 केस ऑल 100 विल डाई. प्रोपोर्शनल मोर्टालिटी रेट टेल्स अस बर्डन ऑफ डिजीज आउट ऑफ टोटल डेथ. इट इज केस death due to specific disease by total death into 100. And specific mortality rate tells about high risk population for death. It is death due to specific disease by total population into 1000. Okay, so try to revise these 3 formula together, and very likely in this upcoming NEET exam they will ask question from proportional mortality rate. This is the one which I am expecting in upcoming NEET exam. Okay, sure. Now let's come. Okay, we have discussed this question. So the next question is, there is a drug which reduces the death but does not cure disease. So what will be its effect on incidence and what will be its effect on prevalence? I think आपने ये क्वेश्चन जरूर कहीं ना कहीं पढ़ा होगा, क्योंकि INI-CET, नीट, MCI सारे एग्जाम का PYQ है. ऐसे मान लो कि डॉक्टर पंकज तिवारी took MD medicine and then he became a cardiologist. And after becoming cardiologist, he found a new drug for BP patient which can prevent death of all the BP patient from heart attack and all, which will keep BP in control for lifelong. So because of this new drug, there is no death due to heart attack. Death is reduced. But as a result of this new drug by Dr. Pankaj Tiwari, people do not die, so they suffer for a long time. जैसे बीपी शुगर के सारे मरीज ना तो मरते हैं ना तो ठीक होते हैं, तो वो लंबे समय तक सफर करते हैं. They suffer for long time because they neither die nor they get cure. So I hope you all know this formula on which again and again they ask question that prevalence of any disease is incidence multiplied by duration of disease. Incidence means, of course, new case. Prevalence means total case right now, total case at present moment. So if due to this drug which is keeping BP under control, people will suffer long. So because they suffer long, duration of disease is more. And if duration of disease is more, prevalence will increase. So prevalence will increase by this drug. But tell me, does new case of BP sugar is affected by any drug? क्या कोई नई दवा मार्केट में आ जाएगी तो लोग बीपी शुगर से बीमार होना छोड़ देंगे? नहीं ना. Disease of diabetes and hypertension is due to lifestyle changes and exercise na. It will be affected by prevention or social change, not by drug. So इस बात को याद रखना, whenever they talk about drug do not affect incidence. ड्रग का नए केसेस पर कोई खास फर्क नहीं पड़ेगा. Do not affect incidence significantly. It can affect significant incidence a bit slightly, but it will not affect incidence significantly. So whenever they talk about drug, incidence will always be same. Incidence will be same. But prevalence can increase or prevalence can decrease. And in this example, we clearly understood that because BP sugar patient are neither dying nor curing, so prevalence will increase, incidence will remain same. So what will happen? The answer will be incidence same, prevalence will increase. But sometime they can twist the question and they can ask that if a new drug cure disease quickly, तुरंत बीमारी ठीक करती है ना, सपोज Dr. Pankaj Tripathi has found a drug which can cure diabetes. Just take it for 1 month and diabetes is gone. So if it is curing quickly due to quick treatment, जल्दी इलाज होने की वजह से लोग कम देर तक सफर करेंगे. Due to quick treatment, duration will be less. And if duration is less, prevalence will be less. So if a new drug cure disease quickly, prevalence will decrease. Prevalence will decrease. And can you tell me what will happen on the incidence? Of course, I hope you all know that incidence is not affected by drug. So incidence will be same, but prevalence will decrease. Okay. So this question can come, new type of question, but I hope you will not be confused. Incidence always same. If it is curing quickly, prevalence will decrease. Sure. The next question is that, can you tell me highly toxic insecticide is coded in which color? Red, yellow, blue, or green? When this question came, almost all the students answered red, but they were wrong. Red or this color of logo, you will find this logo on insecticide used by farmer. And this color red is for extremely toxic, not for highly toxic. An example of extremely toxic insecticide is जिंक फॉस्फाइड, जो चूहे मारने की दवा होती है. कभी कभी इसको कुछ लोग आत्महत्या के लिए यूज करते हैं. किसान के बच्चे वगैरह भी गलती से भी खा सकते हैं या किसान खा लेते हैं, और बहुत ही दर्दनाक मौत होती है. इंसान सच में चूहे की तरह मरता है ना. सो डोंट ट्राई टू सजेस्ट दिस फॉर एनीवन सुसाइड. दिस इज हाईली lethal insecticide, red color, zinc phosphide. Yellow color is for highly toxic, and yellow color will have example of indosulfan. Indosulfan is a highly toxic insecticide, yellow color. Blue color is the thing which they used for moderately toxic, थोड़ा बहुत टॉक्सिक है ना. ब्लू इज फॉर मॉडरेट टॉक्सिक. एंड एग्जांपल ऑफ मॉडरेट टॉक्सिक इंसेक्टिसाइड इज आस्क्ड इन डिफरेंट वे. मॉडरेट टॉक्सिक एग्जांपल इज मैलेथियन. तो यहां से सवाल ये आया है कि विच इज लीस्ट टॉक्सिक ऑर्गेनोक्लोराइड. सो मैलेथियन, डू रिमेंबर, इज लीस्ट टॉक्सिक ऑर्गेनोक्लोराइड और ऑर्गेनोफॉस्फेट है ना. सो लीस्ट टॉक्सिक is malathion, and it is moderate toxic which get blue color. Okay, then green color logo you can find behind your all out or good night mosquito vaporizer in your room. Also you can see a green color logo like this. Green color means it is safe for human use. So green color has all this mosquito vaporizer coil and all, safe for human use. Okay. So do remember this classification of insecticide. Mainly remember that highly toxic is not red color, highly toxic is yellow color. Chalo. The next question is, in elderly how much calcium we need? Elderly and pregnancy, in two group, we need calcium 1200 milligram per day. But if it is pregnancy, in pregnancy we need a bit less calcium, 1000 milligram per day, 200 less. And similarly to all the adult male and female who is watching my video, calcium requirement is same as pregnant lady, 1000 milligram per day. तो आप सभी को और प्रेगनेंसी में मेरे को भी 1000 चाहिए, लेकिन lactating all days 1200. Second question they ask from this part is they can ask about vitamin D dose. तो विटामिन डी किसी को भी पूछे, प्रेगनेंसी, लैक्टेशन, ओल्ड एज, यंग, मेल, फीमेल, एवरीवन नीड विटामिन डी सेम डोज 600 इंटरनेशनल यूनिट, हर किसी को एक ही चाहिए. देन समटाइम दे आस्क अबाउट आयोडीन, especially they ask about iodine in pregnancy and iodine in lactation. So the iodine in pregnancy is 250 microgram per day and iodine in lactation is 280 microgram per day. The iodine which we need for adolescent boys and girl is 150 microgram. Pregnancy 250, lactation 280. Plus, I hope you all know that in pregnancy, we need 350 kilocalorie extra per day, and in lactation, we need 600 kilocalorie extra per day. Okay, so don't forget this requirement part. Plus, I hope you might have remembered it that in NEET exam 2023, they asked this question that what is EAR? Can anybody tell me what is EAR? And how it is different from RDA. EAR और RDA में क्या अंतर है? So EAR is estimated average requirement. 50% जनता की जरूरत को पूरे करने के लिए जितना चाहिए उसको कहते हैं EAR. EAR fulfill need of 50% population. But RDA fulfill need of 97.5% पॉपुलेशन नीड को फुलफिल करता है आरडीए, जिसको कहते हैं रिकमेंडेड डाइटरी अलाउंस. सो आरडीए इज फॉर 97.5, एस्टिमेटेड एवरेज रिक्वायरमेंट इज फॉर 50% पॉपुलेशन नीड फुलफिलमेंट. ओके, चलो नाउ लेट्स कम टू दिस क्वेश्चन. द क्वेश्चन इज दैट वेरी गुड मिस्टर फूडी, मिस्टर अर्पित, Irfan Alam, Aki, you all are replying. Irfan Alam also replied RDA is for 97.5, not for 90%, 97.5, and EAR is for 50%. Very good. Let's come to this question. This was the question based on which similar question came in INI-CET recent exam also. The question was that there is a survey done on 10,000 IV drug user, and it was found that out of this 10,000, 1,000 are having hepatitis. Then during one next year, 100 patient developed hepatitis C infection and died. And also during follow-up of that 1 year, 100 IV users acquired hepatitis C. So which of the following is best estimate of annual incidence of hepatitis C infection? They are asking question from Incidence, which was in recent INI-CET exam also. And to calculate incidence कुछ बुक इसको सिर्फ इंसिडेंस लिखती है, कुछ बुक इसी चीज को लिखती है क्यूमुलेटिव इंसिडेंस. सो क्यूमुलेटिव इंसिडेंस और इंसिडेंस इज सेम थिंग. क्या होता है इसका मतलब? देखो, इंसिडेंस मींस व्हाट इज द टोटल न्यू केस, and in our story how much was the new case of hepatitis C? New case was 100 divided by total susceptible population. Susceptible means total population at risk. कितने लोगों को हेपाटाइटिस होने का खतरा है, टोटल पॉपुलेशन एट रिस्क. और टोटल पॉपुलेशन एट रिस्क का मतलब होता है कि हम लोग, जो लोग ऑलरेडी इन्फेक्शन जिनको हेपाटाइटिस का हो चुका है, अब वो दोबारा तो हेपाटाइटिस होने के रिस्क पे नहीं है ना, क्योंकि अगर मुझे ऑलरेडी हेपाटाइटिस है तो मुझे फिर से थोड़ी होगा. व्हाट आई एम ट्राइंग टू से इज इफ ए पर्सन हैज ऑलरेडी हेपाटाइटिस सी, ओल्ड केस, देन ही कैन नॉट डेवलप हेपाटाइटिस अगेन. सो वी विल सब्सट्रैक्ट ओल्ड केस फ्रॉम टोटल पॉपुलेशन. प्लस if there is someone who is immunized for hepatitis C or immunized for the disease, so because immunity is there, he or she will also not develop new case will also not be at risk of hepatitis, will also not be susceptible for hepatitis. So to find the incidence, we have to write total new case by total population at risk, and total population at risk means total population minus old case minus immunized. Okay, and this we can usually we multiply by 1000, but if the answer is in percentage, we can also multiply it by 100, but usually we multiply it by 1000. तो आओ अब हम अपनी स्टोरी पे चलते हैं. In our story, there were 10,000 total population of IV drug user, but out of this 10,000, 1,000 were old case. So because this 1,000 were old case, now they are not at risk of hepatitis C. Now they will not develop it. So what will be the cumulative incidence here? Total population is 10,000 minus old case, which is 1,000, and no one is immunized for hepatitis C, so this is 0. That means denominator is not 10,000, denominator will become 9,000. So it is 100 by 9,000 into 1,000. Okay. So what will be the answer coming? 100 by 9,000. And if you want to get the answer in percentage, you can multiply this 100 by 9,000 with 100. If you want to get exact incidence, the correct formula will be to multiply by 1,000. So sometime we can multiply by 1,000, sometime by 100 if we want answer in percentage. So that means the main core part will be 100 by 9,000. This is the cumulative incidence. So just remember, whenever they ask cumulative incidence, in the denominator subtract old case from total population and you will get the answer. But one more question which they can which I expect that they can ask if they want to make the paper a bit tough. The question is about incidence rate. What is incidence rate? So the formula of incidence rate is total new case divided by how many person develop it and for how many time they were suffering. Person into time. So how they ask question from this part? They ask question like this, that if in a study we are writing total new case added over time, सभी नए केस को हमने जोड़ दिया एडेड ओवर पर्सन टाइम, कि कितने लोग बीमार रहे, कितने समय तक बीमार रहे. तो ये किसका डिफिनेशन है? टोटल न्यू केस एडेड ओवर पर्सन टाइम. Whenever they use the word time, answer will become incidence rate. Okay, and it is total new case by person into time. Let me explain it with a very simple example. Suppose you are doing a study on a new anti-cancer drug. You started a study in 2023 and a study went till 2025. You took 5 people for the study. First person do not develop infection. Second person developed infection in 2023, died within 1 year of 2024, he died. Second person died in 1 year. Third person developed it and died in 2 years. Fourth person did not develop it. 5% did not develop it. So how many new case occurred? कितने लोगों को 5 में से कितने लोगों को नया केस हुआ कैंसर का? You can see new case is second number and third number. So total new case is 2. Now, in the case of second number case, you can see it yourself that one person developed it for 1 year. And the third person is again one person who developed it for 2 years. So person into time will be written as पहला बंदा 1 साल प्लस दूसरा बंदा 2 साल. फर्स्ट पर्सन 1 year and second person 2 years. So 1 into 1 is 1, 1 into 2 is 2. 1 plus 2 means 3. So incidence rate will come 2 by 3. 2 by 3. So I hope if in exam they ask you to calculate incidence rate, you can calculate it. Plus if they ask the definition which they have already asked one time, that total new case added over person time is known as. So whenever the definition has time word in it, answer will become incidence rate. Okay. So now we know the formula of incidence, incidence rate and prevalence, all three things. Prevalence is incidence into duration of disease. Incidence rate is in new case by person into time. And incidence means new cases by population at risk. I hope you will remember all the three things separately. Chalo, very good. Now, let's go to see this one more question. Yes, very, very good question. This question is saying that in a population, we are talking about hepatitis B in IV drug user. And here they are talking about percentage of people who are getting the vaccine. So in the initial time, vaccinated people were 0 in 2010. But within next 2 years, the vaccinated people increased to 50%. So what we are doing, we are increasing the vaccination rate in a population. हम लोग एक जनता में नए लोगों को सुई भोका भाकी ज्यादा कर रहे हैं. We are giving more vaccines. So the question is, if you are giving more vaccine, which data will get affected by it? If you will give more vaccine, which data will get affected? क्या कम लोग हॉस्पिटल में भर्ती होंगे ज्यादा हेपेटाइटिस के इंजेक्शन देने से? क्या मरेंगे कम लोग? क्या बचेंगे कम लोग? या क्या नए केस ही कम होंगे? क्या असर पड़ेगा वैक्सीनेशन का? दैट इज द क्वेश्चन कि व्हाट इज द इफेक्ट ऑफ वैक्सीनेशन. सो दैट क्वेश्चन लुक बिग, but if you decode it, it is very simple. They are just asking what is the effect of vaccination. And I hope you all know what is the purpose of vaccination. Vaccination means prevention. Which level of prevention? It is primary level of prevention. Primary prevention means prevention when risk is there, disease is not there. जब खतरा हो और बीमारी अभी ना हुई हो, तब हम कहते हैं प्राइमरी प्रिवेंशन. सो प्राइमरी प्रिवेंशन मींस रिस्क प्रेजेंट, डिजीज एब्सेंट. एंड आप खुद ही सोचो, आपने कोरोना की वैक्सीन कब लगाई थी? 2000 में ही लगा ली थी या 2020-21 में लगाई जब कोरोना का खतरा था? ऑफ कोर्स we took COVID vaccine when the risk of corona was there in 2020-21. We did not take it early. So that's why all vaccination are example of primary prevention, except BCG vaccination, which can be given for the treatment of bladder cancer also. And whenever we talk about early diagnosis and treatment means secondary prevention. So vaccination is primary prevention, but if BCG vaccine is used for treatment of bladder cancer, then it becomes secondary prevention. और यहां से सेकेंडरी प्रिवेंशन से कंफ्यूजिंग क्वेश्चन आते हैं. आप हमेशा याद रखना, अगर एक एडल्ट मेल का बीपी ले रहे हैं, सोच के बताओ, इफ बीपी ऑफ ए हेल्दी एडल्ट इज टेकन, बीपी ऑफ हेल्दी एडल्ट, you have to answer that is it primordial, primary or secondary? Which level of prevention it will be? Primordial, primary, secondary. BP of healthy adult. Tertiary I have not kept in option because I think you know tertiary we do when we want to limit the disability or we want to make the person self dependent. आत्मनिर्भर बनाने के लिए या बीमारी के मरीज की जो डिसेबिलिटी है उसको लिमिट करने के लिए हम टर्शरी करते हैं. लाइक वेरी गुड एग्जांपल ऑफ टर्शरी प्रिवेंशन इज when you are cleaning the leg of a filariasis patient or leprosy patient, it is to limit the disability. Disability limitation is tertiary. So BP of healthy adult, it is primordial, primary, secondary. Try to answer. Primordial, primary, secondary. What is the answer? See, many students are writing primary. Very good. Aki is writing secondary. Mr. Foodie is also writing, I think, secondary. देखो, when we are taking BP of a healthy adult, what is the purpose of taking BP? Purpose of taking BP is early diagnosis of hidden hypertension. जो छुपा हुआ हाइपरटेंशन है उसको पता लगाने के लिए बीपी ले रहे हो ना. तो ऑलवेज रिमेंबर, no matter if we take BP of healthy adult or BP of a 10-year-old kid, or sometimes they ask question BP in a health fair, no matter whose BP I am taking, purpose of all screening tests, including BP, is early diagnosis. And because the purpose is early diagnosis, this is example of secondary prevention, not primary prevention. So always remember, all screening tests are example of secondary prevention. All screening tests. And from here, sometimes they ask the question that a son took his hemiparesis father for BP checkup. है ना, जैसे मेरे पापा को हेमीपैरेसिस था, तो मान लो मैं अपने पापा जी को बीपी चेकअप के लिए ले जा रहा हूं. So even if it is a hemiparesis patient, if I am taking him for checkup, it is secondary prevention. If the son is taking his father for physiotherapy, then it is tertiary. If the son is taking his father for checkup, it is again secondary. So all screening tests are secondary and all vaccination are primary except BCG vaccine for treatment of bladder cancer, which is secondary. So here we are giving vaccine to prevent new case. And anyway, vaccination is given to prevent the disease. So when in this question, when we increase the vaccination of hepatitis, new case will decrease. That means which will decrease? Incidence will decrease. Now you will say, ki, sir, if incidence will decrease, of course, case fatality rate will also decrease. Hospitalization will also decrease. They can decrease. But what will be the first effect? First effect is, if we will vaccinate more people, incidence will decrease. Okay. So this is the first effect. And after incidence decreasing, hospitalization case fatality rate can decrease after that. But median survival will not decrease. Median survival will increase. So what will not decrease? Median survival will not decrease. And what will decrease first? Incidence will decrease first. Okay. And the question was, most likely what will be the affected data? What is the first affected data? So the first affected data will be incidence. When you will vaccinate more people, incidence will decrease. Okay. So that is the answer. I hope you like the question. Yes, very good. Thank you for replying in with such a prompt way. Okay, tell me now, look at the photo of this child and tell me, does this child have measles, chickenpox or rubella? क्या हुआ इस बच्चे को? है ना, ये निखिल का होने वाला लौंडा है ना? You can see this kid is having some rashes on the face. So if they give image of rashes on the face, you can rule out rubella, because rubella के rashes को हम लोग कहते हैं फूल कुमारी rashes. We call it flower rashes in common language. Rubella rashes mostly occur on body, do not affect face much. Plus, rubella and chickenpox, these two diseases, they will have rashes but without any cough, cold, coryza, conjunctivitis. That means rubella and chickenpox are dry fever with rash. Okay. So this cannot be rubella. It can be either chickenpox or measles. What is your answer in this case? One student is answering measles, one is answering chickenpox. So to identify this, remember why we call chickenpox as chickenpox. Because just like जैसे chicken का चोंच बाहर निकल के आता है ना, just like beak of chicken come out, rashes of chickenpox come out from the skin. है ना, इसीलिए चिकन के पॉक्स के रैसेस को एक डॉक्टर ने, जिसके अंदर एक कवि की आत्मा थी, ऐसे बोला था कि ऐसा लगता है जैसे गुलाब की पंखड़ियों पर ओस की बूंदें हों, है ना. इट लुक्स लाइक ड्यू ड्रॉप्स ऑन रोज पेटल. व्हाई? बिकॉज जस्ट लाइक ड्यू ड्रॉप्स और चिकन बीक कम आउट, chickenpox rash also come out from the skin. But when it comes to measles rashes are known as sand particle like rashes. They are within the skin surface, merged with each other. And in this child, you can see many rashes are merged with each other and no rashes is coming out from the skin. So this is not chickenpox, this is measles. Now you will say, ki, sir, you just say कि measles will have cough, cold, coryza, conjunctivitis, but there is no secretion in this child. There is no secretion here, but you can see this child is opening the mouth to breathe. That may be because he have received some antihistaminic like cetirizine and syrup and all, and due to that the secretion has dried up. So secretion cannot be seen in every child, but main feature is chickenpox rash will come out, measles rash will be within the skin surface. So this child has which infection? Measles. Plus do remember one more thing, measles rashes always start from back of hairline, back of ear, from here, then it go to face, and then it go to body and trunk. And I hope you all know in measles, the pathognomic sign is Koplik spot. And where will you find Koplik spot? On the buccal mucosa of upper 2 molar or lower molar. This is on buccal mucosa of lower first and second molar. Upper molar will have opening of extension duct from parotid gland, because extension duct will not travel all this distance and come down, it will open here. And Koplik spot is near buccal mucosa of lower first second molar. And if it is rubella, in rubella the pathognomic sign is Forst-Scheimer spot. This Forst-Scheimer spot are pink dot on soft palate. Okay, pink exanthema, actually not dot, pink exanthema. Exanthema means जब स्किन हट जाती है तो जो पिंकिश ग्लो आता है उसको कहते हैं पिंक एक्जेंथेमा. व्हेन द म्यूकोजल लेयर इज गॉन देन इट इज exanthema, pink exanthema where on soft palate. So this is characteristic of rubella, and remember rubella and chickenpox, they are dry fever. Plus then they ask the question that chickenpox is centripetal or centrifugal. So it's so easy to remember, CP for chickenpox, CP for centripetal. So chickenpox will occur on trunk and body, will not affect palm and sole. But if it is monkeypox and smallpox, they will be centrifugal. They will affect palm and sole first. Okay, chalo. What has happened to these two patients? These are the honey crusted lesion. Okay, honey, and don't try to lick it, but this honey crusted lesion occur in which disease? I hope you know the disease in which honey crusted lesion occur is impetigo. Okay, chalo. Now let's come to a very interesting and intelligent question. The question is that there is a large study which is done for diagnosing a new disease, and they are using this is the value which is for sensitivity 70%, specificity 90, PPV 95, and NPV is 90%. Now they are asking about positive likelihood ratio. This formula, positive likelihood ratio formula, is something which is remembered by only few students. And if you don't know the formula, you cannot find positive likelihood ratio. So let me tell you the formula of positive and negative likelihood ratio. And if you remember it once, I still remember in every exam I used to read it and remember it, and within the exam I used to get confused that what is the real formula of positive likelihood ratio. So it's not difficult to remember. See, this positive likelihood ratio and negative likelihood ratio, in both of their formula we write sensitivity above and specificity below. Sensitivity by specificity. Here also sensitivity by specificity, same thing. And I am expecting this NEET exam paper to be a bit tough, just like NEET UG was a bit tough. NEET PG, I am expecting it to be tough, and then such tough question can also come. So how you will remember the formula? The difference in this two thing is, in the positive likelihood ratio, 1 minus sign is in the denominator, and in the negative likelihood ratio, 1 minus sign is in the numerator. Okay, so to remember the formula for above, one of the student in Jaipur, I was taking the class, he told me a good way that, sir, consider this 1 minus sign as penis or thought of sex. And when penis or thought of sex is below the belt, under our control, then our mind can focus in study better and our marks will become positive, it will increase. So this minus sign or penis or thought of sex should be below, under the belt, then we will grow positive in our exams. But when this thought of sex is every time in the mind, then we cannot focus on study and our marks will become negative or less. So if you have 1 minus below, it's positive likelihood. 1 minus sign above is negative likelihood ratio. I hope this weird example will not let you forget this formula forever. And now simply just put the value. What is the sensitivity here? 70%. What is the specificity? 90%. So if you put sensitivity 70%, specificity 90%, what will come out? Numerator is 0.7. 70% can be written as 0.7. And denominator is 1 minus 0.9 because 90% can be written as 0.9. So 0.7 divided by 1 minus 0.9, it means it is coming 0.7 by 0.1. Point will cancel out, answer will be 7. So the positive likelihood ratio will come out to be 7. But originally that Jaipur student had given me this weird trick for one different concept. The concept is such a question which has already came 2 times in INI-CET, 1 time in NEET exam. That is the concept when they give you box and whisker plot. And they ask in the box and whisker plot, if the bar is in the lower side, is it a negative skewed curve or is it a positive skewed curve? Which type of skewed curve it is? You know, this is a very common question. So I hope you know that in the box and whisker plot, the lower part is at 25 percentile or percent and above part is 75%. And if the bar is in the center half, we can draw an imaginary line going like this. And here, let's say, suppose at 40% you have this bar. So this part, which is between 40 to 75, this part is the skewed part. And you all can see skewed part is going towards bigger number. देखो यार, एक बात तो सिंपल है कि 40 से 75 बड़ा नंबर है ना. 40 to 75 is bigger number as compared to 25 to 40. And in your life, if you are going towards bigger number, bigger money, you are positively going in your life na. So similarly, in a curve also, if the skewed part is towards bigger number, we call this curve as positive skewed curve. Similarly, they can create another question from here. They can put bar above. And if they put bar above, then the skewed part will be towards lesser number, 60 to 25. And if it is towards lesser number, we call it negative skewed curve. So again, sometimes we get confused in positive negative skewed curve thing. Sometimes we get confused in positive and negative skewed thing. But again, it is nothing to confuse by using the same logic here. Imagine this bar as penis or thought of sex. And if the bar is lower side, bar or penis or thought of sex is under our control, then we can focus in study better and we will be positive in our life. So this is positive skewed curve. But if the penis or thought of sex is every time in our mind, then we cannot focus on study and our marks will decrease and this will be negative skewed curve. Okay. So positive and negative skewed curve can be remembered by the same trick by which we remember the formula of positive and negative likelihood ratio. In positive likelihood ratio, 1 minus is below the belt. In negative likelihood ratio, 1 minus is above the numerator part, always in our brain. And then sensitivity specificity is common in both of them. Okay, so I hope you will not forget these two formula and you will also not forget these two curve questions. Plus, what is the purpose of box and whisker plot? In the box and whisker plot, if the dot line is in the center part, this is a normal box and whisker plot, normal curve. and the dots which they show here, this is outlier. So this is actually the purpose of box and whisker plot. Box and whisker plot we draw to identify outlier. Box and whisker plot identify outlier. ये outlier होता क्या है? What is this outlier which is identified by box and whisker plot? Outlier means extreme value. Like every 2-3 years, they do a survey in UK population ki how much sexual partner you have lifelong. And usual answer is 2 to 7. But in the same UK population, some hunter, they give the data 699 sexual partner, 593 sexual partner. So should we include those hunter data in normal data, or should we remove them by calling them outlier? Of course, we should remove them by calling them outlier. So if any data is too far away than the whisker matlab poonch, if it is away than the whisker or tail, then we call that data outlier, and it is identified by box and whisker plot. Okay, chalo, I hope it is clear. Now let's come to the next question. Question is from the demographic cycle, which came again in NEET 2024 also. The question is, in which phase you will find zero growth rate? In phase 4, 2nd, 3rd, 5th. Do reply it. Where will you find zero growth rate? Similarly, they have asked this one more question, that high birth rate. High birth rate is in which phase? Is in which phase or phases? Okay. Option A, high birth rate is in phase 1 only. High birth rate is in phase 1 and 2 both. High birth rate is in 1 and 3. High birth rate is in 1 and 4. Where will you find high birth rate? 1 or 1 and 2 or 1 and 3, 1 and 4? Do reply this part also. So to answer both of this question, I hope you should know the demographic cycle part. And in the demographic cycle, let's first draw the demographic cycle image, because a lot of image based question also come from demographic cycle. In the image, I hope you must have seen it. Very quickly we will draw it. These are the 5 phases, 3, 4 and then 5. Okay. Where do India belong? India belong to phase 3, late expanding. देखो, before 1950, India was in first phase, high stationary. And in high stationary, because in NEET 2024, they asked 2 questions from it, and they asked the marking of different line also. So this is very important to revise. Suppose I am drawing birth rate with red, yellow. This is the birth rate, and I am drawing death rate with white. So birth rate, death rate in the first phase, birth rate and death rate both were high. Both were high in first phase, and that is why people who are taking birth, they are dying also. So population was stationary. Then in the second phase, what happened to the birth rate? Birth rate still remain high. So birth rate is high in 2 phases, phase 1 and phase 2. In both the phases, birth rate is high. Okay. So very good, Dr. Pankaj Tiwari. You were right in replying that in this question, which I was discussing, in which phases high birth rate is found? Phase 1 and 2 both. In these 2 phases, birth rate is high. Okay. 1 and 2 birth rate is high. Then in the third phase, where India belong, birth rate start decreasing. Fourth phase, it decreases further. Fifth phase, it become very low. So birth rate is high in 2, then start decreasing and keep on decreasing. When it comes to the death rate is something which start decreasing in second phase only, because delivery start occurring in government hospital. So death rate start decreasing in second. After 1950 till 1990, India was in phase 2. This phase is of course known as early expanding. Okay. and then in third phase it decreases, fourth phase it become low, death rate become low, and in fifth phase you can see death rate become more than birth rate. So that is why fifth phase is known as declining, in which China entered last 2 years. China birth was less than death, so China was also declining in last 2 years. And in the fourth phase, the country are in low stationary. तो देखो याद करना इतना मुश्किल नहीं है, ये बहुत आसानी से, वेरी इजीली यू कैन रिमेंबर डेमोग्राफिक साइकिल. फर्स्ट एंड फोर्थ इज स्टेशनरी, फर्स्ट इज हाई स्टेशनरी, फोर्थ इज लो स्टेशनरी. India is in late expanding, third phase, and second phase is early expanding. Last is declining, and declining have death rate higher than birth rate. So marking the question in NEET exam 2024 was, what is this second line? So this second line is definitely death rate. But they can also ask one more question here. If I draw a line something like this, what is this line indicating? This is indicating population growth. Our population is growing like this. It is, and one more question they ask from here is, which phase has maximum growth rate? So you should know this formula, because a small numerical is going to come in this NEET exam from the formula of growth rate. Growth rate, and because this question has came in MCI exam already, not yet repeated in NEET, so it can come in NEET. Growth rate is birth rate minus death rate by 10. By 10. Don't forget to divide by 10. जितने लोग पैदा हुए माइनस जितने लोग मर गए, वही तो उस कंट्री का ग्रोथ हुआ ना. लेकिन इसको हम 10 से डिवाइड करते हैं, क्योंकि बर्थ रेट डेथ रेट 1000 में आता है और ग्रोथ रेट 100 में आता है, और 1000 और 100 में एक जीरो का अंतर है. उस जीरो को हटाने के लिए हम 10 से मल्टीप्लाई डिवाइड कर रहे हैं, बिकॉज बर्थ रेट डेथ रेट आर इन 1000 and growth rate is in 100. So to remove one extra zero, we are dividing birth rate death rate with 10. Okay. So the question, one more question which they ask from marking part is, which phase has maximum growth rate? So maximum growth rate in this part, late half of second, this has maximum growth rate, because this has maximum gap between birth and death. Then the second question they ask is, where do growth rate start decreasing? So growth rate start decreasing in early half of third phase. So growth rate start decreasing in early half of third phase, late expanding, where India belong right now. So if you remember this much part, I am hoping one question will again come from marking or from demographic cycle part, which you can answer. Now that's why I was going in much detail. So now let's come back to our question. Our question was, the zero growth rate is in which stage? Fourth, second, third, fifth. Can you answer? Where will you find zero growth rate? Zero growth rate simply means population is stationary. And stationary are two phases: high stationary, phase 1, and low stationary, phase 4. So which phase has zero growth rate? Fourth and first. Because first is not in the option, so answer is fourth. Then which phase has negative growth rate? Negative growth rate is in fifth, and that is why fifth stage is known as declining, because it has negative growth rate. Death rate become more than birth rate. So do remember demographic cycle and these two questions which had been come from this part. Okay, chalo. Now can you answer this device? What is this device? This device is multi-load 375. Again a PYQ of NEET exam. My question to you is, multi-load 375, is it first generation IUCD? Is it second generation IUCD? Or is it third generation IUCD? Which generation IUCD it is? Okay, can you answer this? Very good. So which generation IUCD is this? First, second, or third generation? My dear friend, they have asked an image based question from first generation IUCD. First generation IUCD have only one example. This snake like image will be there. This is Lipley's loop, or Lipley's loop का एक ही प्रॉब्लम था कि ये लूप से निकल जाता था. You can see there is no point of attachment here. So Lipley's loop used to come out very easily. There is high expulsion rate. That is why Lipley's loop is no more used. This first generation Lipley's loop image based question I am expecting in this NEET exam. Do remember. Then multi-load 375, is it second generation or third generation? People think it is third generation because it is multi-load. So they think hormone will be here and it is third generation. Because third generation, I hope you all know, is hormonal IUCD. But if they give hormonal IUCD image, hormones are liquid. And to store liquid, you need plastic thing. So third generation IUCD will always be plastic IUCD. And here you can see the metallic part. No plastic part is here. Now plastic part is in the upper part for the attachment inside the cervix. But this part is metallic, so it cannot be third. It is second generation IUCD. Very good. All of you have seen this. So it's good that you see this and you know this. But I am asking this question not just for knowing that it is multi-load, but to revise all this three generation IUCD very quickly. So third generation have two example, Mirena and Progestasert. Both will have plastic thing in it. Now Progestasert protect for 1 year and Mirena protect for 5 to 10 year. Park writes 7 to 10 year. Gynae people teach 5 to 7 year. So you can remember it roughly 5 to 10 year. Good answer is 7 year. Mirena protect for 7 year. Progestasert 1 year. And when it comes to second generation IUCD, this is multi-load 375, which just like copper T 200 AG and Nova T, all this three second generation, they all protect for 4 to 5 year. But when it is copper T 380 AG, that I hope you all know protect for 10 year. And what is this 380? 380 is the surface area. They ask the question, that is the surface area in centimeter square or millimeter square. Surface area is in millimeter square. And of course, it protects for 10 years. So these are the three generation IUCD and very good. All of you were correct. This is multi-load 375, second generation IUCD. Now, from the IUCD part, it's second generation IUCD. They are asking this question again and again. What is the time of insertion of IUCD? What is the last time at which we can insert IUCD? What is the first time with which we can insert IUCD? So the best time of insertion of IUCD is within 10 day of period. Because within 10 day of period, there is no chance of pregnancy and cervix is also dilated, so you can insert it there. Then there is postpartum IUCD just after delivery, and this is not the ideal time for insertion because if you insert it just after delivery, uterus is soft, it can rupture also, plus uterus mouth is open due to delivery, so IUCD can expel out also. So it's not ideal time. So what is the ideal time? Ideal time can be within 10 day of delivery or within 10 day of period or 6 to 8 week after delivery. Because female come for first 5 vaccine at 6 weeks, so at this time you can insert IUCD 6 to 8 week. So up to 8 week after delivery we can put it, because in the first 3 month due to lactational amenorrhea there is less chance of pregnancy. But lactational amenorrhea protect for 3 months only if the breastfeeding is exclusive. If along with breastfeeding mother is also using powder milk or some other milk, then it is only 6 week of exclusive of lactational amenorrhea. So if there is exclusive breastfeeding till 12 week pregnancy protection, if there is not exclusive breastfeeding, only 6 week pregnancy protection is there. Okay, so do remember this part. And the time of insertions also. And what is the most common complication of IUCD? So the mnemonic is PR, just like per rectal examination or PR. Pain is the most common cause of removal. Pain lead to removal. But what is the most common complication? Most common complication is bleeding. So most common is bleeding. Other than bleeding, what is the two most common side effect of IUCD? That is pelvic inflammatory disease and ectopic pregnancy. Okay, so these are also contraindication of IUCD. Unknown bleeding from uterus, which can indicate cancer, or PID or ectopic pregnancy. And in case of OCP, they ask which two things is decreased by OCP. PID and ectopic pregnancy is decreased, and bleeding also. All these three things, which are complication of IUCD, is decreased by OCP. Okay, so do remember it. Now let's come to the next question. This is a question which very few of us know. What is epidemiological transition ratio? So we have done this. So what is epidemiological transition ratio? See, in the epidemiological transition ratio, we are writing the death or the cases. Mainly we are denoting the deaths due to CMNND. Like, let me write it down properly. In the epidemiological transition ratio, in the numerator, we write death or cases due to. Let me show you the questions also, the numeric ratio, the definitions also. Ratio greater than 1 means higher burden of NCD and injuries as compared to communicable maternal, neonatal and nutritional related disease. Is this correct for epidemiological transition ratio? Or ratio greater than 1 means higher burden of communicable maternal, neonatal and nutritional related disease as compared to NCD. So, and ratio 0.3 or less indicate lowest epidemiological transition ratio, or both A and C are correct. What is epidemiological transition ratio? I hope you all must, this is the part given in Park textbook, and once a question has come from it, you might be knowing that gradually the infection disease is decreasing and non-communicable disease is increasing. Pneumonia, diarrhea, they are decreasing, and diabetes, hypertension are increasing. So in the epidemiological transition ratio, Kerala have epidemiological transition ratio of 0.16 and Bihar have epidemiological transition ratio of 0.74. That means, of course, I hope you all know Kerala have India's best health system. Therefore, due to good health system, diabetes, hypertension are more than infectious disease. So if Kerala has low epidemiological transition ratio, it means the death due to cardiovascular disease we write below. Okay, and death due to CMNND. What is the full form of CMNND? Communicable disease, maternal disease, neonatal nutritional disease. Death due to CMNND. This we write in the numerator, and cardiovascular disease we write in the denominator. That is why Kerala have it 0.16, very low. This Kerala has 0.16, and 0.16 indicate high epidemiological transition, because Kerala has already gone from communicable disease to non-communicable disease. And what we usually think is cardiovascular disease should be in the numerator. No, cardiovascular disease like BP, hypertension, diabetes, they are in the denominator, and communicable maternal, neonatal disease and nutritional disease, they are the numerator. So if the epidemiological transition ratio is something which we are talking about, and it is in Kerala, epidemiological transition ratio is high. That means whenever the transition ratio is less than 0.3, less than 0.3 epidemiological transition ratio means it is high epidemiological transition. Like in Kerala, it has already been done. Epidemiological transition ratio has become high. So this line C, if you look, C is rating 0.3 indicate lowest epidemiological transition. No, 0.3 indicate, less than 0.3 indicate highest epidemiological transition ratio. Like for Kerala, it is highest 0.16. Okay, so it's not lowest, it's highest. It look like 0.3 should be low, but the opposite is correct. 0.3 is highest epidemiological transition. Why 0.3 is highest? Because in the numerator we don't write NCD. In the numerator we write communicable, maternal, neonatal and nutritional related disease, and in the denominator we write NCD and injury. So what is the correct definition of epidemiological transition ratio? The correct definition is we take the ratio between CMNND, communicable, maternal, neonatal, nutritional disease we write above, NCD we write below. This ratio is epidemiological transition ratio. And if epidemiological transition ratio is greater than 1 means we are talking like Africa like country where communicable disease are still high and NCD is low. Okay, so ratio greater than 1 means CMNND is high and NCD is low. Correct answer is B. If this question came again in this exam, very few students will be able to answer it, because we think NCD should be above in transition. No, transition have communicable disease above, NCD below. So if epidemiological transition is low, that means it is highest transition. Like in Kerala, epidemiological transition ratio is 0.16, which means highest epidemiological transition. Okay, it look a bit confusing, but if you will be able to understand it, it will be clear. Okay, chalo. Dr. Pankaj Tiwari have a doubt that in Obs and Gynae they are saying that within 48 hours if we insert IUCD, that is the ideal time. What we should choose? So should we choose PP-IUCD as ideal, or should we choose within 10 day of period or 6 to 8 week after delivery as ideal? So the reason why government promote PP-IUCD is because during delivery it's easy to take permission of mother. They have suffered the pain, so they will agree for no more children in future. And therefore on the delivery table nurses and doctor ask, should I put copper T, and there they cannot deny. So it is something which government is promoting. But in the Park textbook they have written this 2 point specifically. I can forward you this thing is that PP-IUCD, PP means postpartum, just after delivery or within 48 hours of delivery. If you insert IUCD, first thing is high perforation rate, which I told you, because this time uterus is soft, it can perforate. Second thing is high expulsion rate. Okay, so because at this time perforation rate and expulsion rate both are high, this can never be ideal time of insertion of IUCD. And this I am not telling based on my knowledge, I am telling it based on the thing written in Park textbook. And in exams of NEET or MCI or INI-CET also, whenever they ask question regarding Indian guideline, you have to answer based on what is written in Park textbook. So do not trust on expert like me, because expert can be wrong, can be biased. You have to trust on evidence which come from standard textbook. So this evidence is written there, and of course you know this also, ki high perforation and high expulsion will occur at this time. So this is not the ideal time of insertion. What I can do is, if you will message me at my number, I can forward you this line written from Park textbook, that these are the two complications which can occur when we insert IUCD just after delivery. So this is not the ideal time. And Park has written that one of the best time of insertion of IUCD is within 10 days of having menstrual period, because within 10 days the cervix is dilated and there is no chance of pregnancy, so you can insert it there. Plus after 6 to 8 weeks we can insert. So the question, if they ask what is the maximum time up to which we can insert IUCD, so maximum time after delivery we can insert IUCD is 8 weeks is the maximum time up to which we can insert IUCD. If they okay, I will forward you the evidence. If you message me on WhatsApp, I can give you the evidence. Plus you can also join the Telegram group of PW Meded. You can ask me this question to share the evidence. I will share it there also. Okay, So definitely that answer which gynae teacher might have given is based on uh, knowledge but not evidence, and you have to agree with evidence, not on expert opinion. Do not trust me, trust Park. Okay. Chalo. So this is there. I hope epidemiological transition ratio is clear. We write CMMND above, NCD below. Next question is, what is correct for type A PHC? What is correct for type A PHC? It has less than 20 delivery per month, less than or equal to 20 delivery per month, more than 20 delivery per month, more than or equal to 100 delivery per month. What is correct for type A PHC? This is one thing which I hope you know. Kindly answer. See, when we talk about subcenter, type A and type B are two type of subcenter. On which subcenter delivery can occur? Type B delivery can occur. Delivery cannot occur on type A. Okay. So no delivery A, and if they are talking about delivery can occur, that is B. And I hope you all know for the subcenter population norm is 3000 to 5000. 3000 in hilly area, 5000 in plain area. Now let's talk about PHC. Some of you are giving A, one of you are writing answer B, but Mishra, Sindhu, Ritambra, John, Aki, Sahitya and Pankaj, they all are replying. Thank you for replying. I hope you have seen this question earlier. If they talk about PHC, you can very easily remember type A means less than 19 or equal to 19. As soon as you will go to 20 or more than 20, delivery is type B. Okay. So type A means less than 20. If they say less than or equal to 20, then it is not correct for any one A or B. And if they say more than 20 delivery or equal to 20 delivery, then it is type B. So type A is 19. Just remember like that. 19 or less is type A. Similarly, sometimes they also talk about CHC. CHC type A means 99 or less than 99 delivery. And if it become 100 or more than 100, it is type B CHC. Okay. And when it comes to the population norm, I hope you already know PHC is 20,000 in hilly area, 30,000 in plain area. CHC is 1 lakh plus minus 20,000. That means 80,000 to 1 lakh in hilly area and 1 lakh to 1.2 lakh in plain area. But nowadays, they are not asking question from rural health mission. They are asking question from population norm of National Urban Health Mission. And this time in NEET exam, I am expecting that they will ask you about Mahila Arogya Samiti, MAS. This Mahila Arogya Samiti is group of female living in slum area who are at 2200 household. And government of India think that in each household roughly 5 people live. So what is the population? 20 means 20 into 500 and 100 into 5, 500. So this question I am expecting that what is the population norm for Mahila Arogya Samiti MAS Tufan Utha De, one man army, that is MAS there. So do remember MAS, group of female, and who they report to? Report to Usha. Usha, one Usha is, this question has already been asked, 1000 to 2500 population. When it comes to ASA, there is a big controversy about minimum educational qualification of ASA. Again, one area where people trust on Google or their knowledge but don't look at Park. Park has clearly written that ASA is, one ASA is at 1000 and ASA should have minimum education of 8th pass. In 10, if you will look at the Google say 10th pass, but Park textbook latest edition has written in 3 time, they have written minimum is 8th pass. But still, sometime when people go to Google, they answer 10th. But in exam, you have not to write on based on Google or teacher. No matter how good the teacher is, you have to trust on evidence. what I am saying doesn't matter, what Park saying matter. And Park 3 places say minimum education of ASA is 8th, and it is 1 ASA per 1000. If again you don't trust me, I would love you if you don't trust me, because I'm teaching you not to trust expert, trust on evidence. And again, I have given you my number. Just message me on that number. I will share you the photo of Park latest edition where they have written it. So Usha is 1000 to 2500. Usha report to urban ANM, which is at 10,000 population. So do remember, in urban areas, urban subcenter is not present. There is nowhere urban subcenter like thing. Then they have asked this question that what is the population norm for urban PHC? Urban PHC is 1 at 50,000 population, and urban CHC who get reporting from PHC is at 2.5 lakh to 5 lakh population. Roughly 5 PHC come under 1 CHC. And then this was one of the NEET PYQ, that can we open CHC in the same area where there is medical college or district hospital? Answer is yes. We can open urban CHC, medical college, district hospital in the same campus. Less serious patient will go to urban CHC, more serious will go to district hospital or medical college. So we can open them together. Population norm of NUHM, especially mass and urban Usha, don't forget, they can ask it again. Urban PHC, they have already asked, 1 at 50,000. Urban CHC, 2.5 lakh to 5 lakh. Chalo. Next question. Which is correct for ESI guideline? So you have to think which is correct. Employee get 0.75, employer give 3.25% of ESI contribution. This is correct line. How much state government give, how much central government give? So state government give 1/8 of ESI contribution, and central government give 7/8 of contribution. So ESI is mainly run by central government. 83.5% come from central government. 3.25 and 0.75 if you add, 4% come from employee and employer. 12.5% come from state government, and remaining 83.5 come from central government. So ESI is mainly funded by central government. Now on the similar pattern, two more question has been asked. First question, Ayushman Bharat, is it center government program or state government, or both center and state fund for it? Many people, they answer it is center government because they think only BJP is doing it. No, Ayushman Bharat is also funded by both center and state. Okay. Similarly, if you look at Food Safety Standard Authority of India, food safety also come under both center and state. So Ayushman Bharat and FSSAI, they are both center and state, not just center or state, both center and state. In Ayushman Bharat, center give around 60 to 70% fund, state government give around 30 to 40% fund, but they are funded by both. Okay, just like ESI. Now, which is correct for demographic bonus? So bonus, sometimes they change the question and they ask about demographic dividend. So bonus is a good news or a bad news? Of course, I hope you all know bonus is a good news. Bonus or dividend, same thing. So it is a good news. And now tell me which option is correct. You will get the bonus if dependency ratio increase or dependency ratio decrease. I hope you know dependency ratio का सीधा मतलब है कि निर्भर लोग कितने हैं, how much are dependent people. And if dependent people are more on any country, it is not a good news. So good news means bonus or dividend, and country will get bonus or dividend if dependency ratio will decrease. So either answer C will be correct or D will be correct, because dependency ratio has to decrease, only then it is bonus or good news for the country. Now what is the formula of dependency ratio? I hope you all know, and they have already asked one numerical on this formula in MCI exam just 1 year back, that of course it is less than 15 year plus more than 65 year, and in the denominator it is 16 to 64 year, multiply by 100 to get the answer in percentage. So good news come when dependency ratio decrease, then it is demographic dividend or bonus. Now, how can you decrease dependency ratio? There is only one method of decreasing dependency ratio. If we stop producing children, then this less than 15 year will be less and demographic dependency ratio will decrease. अगर फर्टिलिटी रेट को हम कम कर दें, बच्चे पैदा कम करने लगे, तो 15 साल से कम वाले कम हो जाएंगे और 15 साल से कम वाले कम होंगे तो डिपेंडेंसी रेशियो कम होगा और कम लोग निर्भर होंगे तो देश के लिए बोनस की तरह न्यूज होगा, अच्छा न्यूज होगा. सो डू रिमेंबर, व्हेन दे टॉक अबाउट बोनस, बोथ शुड डिक्रीज. फर्टिलिटी रेट शुड आल्सो डिक्रीज and dependency ratio should also decrease. So what is the correct answer for demographic bonus? Answer D. Decrease in dependency ratio, decrease in fertility. Both should decrease. But sometimes they ask the question of demographic burden. हमारे देश पर बोझ कब पड़ेगा? Burden का मतलब होता है बोझ, है ना? बोझा कब पड़ेगा? When it will be a burden for our country. Of course, burden is when dependency ratio will increase. And how can you increase dependency ratio? Again, the same way. To increase dependency ratio, you have to increase fertility rate. So, when they talk about bonus, if they talk about bonus, both should decrease. In bonus, dependency ratio, fertility rate, both decrease. And in burden, both should increase. So, do remember this point. Burden, both dependency ratio, fertility rate increase. Bonus, both dependency ratio and fertility rate decrease. Both increase burden, both decrease bonus or dividend. Okay, just like that, you can remember it and you will never be long. Now, what is this image suggestive of? Can you answer this? What is this image suggestive of? Option is here: excess of fluorine, deficiency of fluorine, or plumbism. What is this? Plumbism means lead poisoning. And I hope you all know, if there is lead poisoning, the symptom will be A, B, C, D, E. A for anemia, B for toothing, basophilic stippling, and Burtonian line. Basophilic stippling is blue color basophilic granule inside RBC. And Burtonian line means blue line on upper gum. Image based question can come from there also. Aminolevulinic acid is something which you will find in the blood of the patient if lead poisoning is there. And then another question from plumbism is, what is the most common route of plumbism or lead poisoning? Most common route is inhalation. So plumbism, why it occur? Due to inhalation. I asked in one of the class, student ने बोला सर इंजेशन खा करके. मैंने बोला वो कैसे? तो सर लिपस्टिक में होता है लीड, इसलिए इंजेशन मोस्ट कॉमन होगा. मैंने बोला भाई तू लिपस्टिक ज्यादा खा रहा है, इसका मतलब ये थोड़ी दुनिया खा रही है ना. Ingestion is not the common route. Common route is inhalation because lead is also in many paint and all. And in urine of the patient, if you found aminolevulinic acid, then this is suggestive of raised aminolevulinic acid in urine or coproporphyrin in urine. This two things, if you found in urine, this is suggestive of plumbism, coproporphyrin or aminolevulinic acid. Okay, so what are the symptoms of lead poisoning? Anemia, basophilic stippling, Burtonian line. C for constipation, yani tutty tight. D for wrist drop, and E for encephalopathy. And what is the drug of choice for plumbism? The drug of choice is EDTA, ethylene diamine tetraacetate. Now, what is happening in this question? I hope you all know. This question have white plaque deposition on enamel of the teeth. This is dental fluorosis. And dental fluorosis occur if fluorine is more than 1.5. The question which they are going to ask this time is, when do brittle bone occur? When does skeletal fluorosis occur? And they will ask the level of fluorine. So if they are talking about skeletal fluorosis or brittle bone will break without reason, है ना. Patient will come and say कि sir सुबह टट्टी पे बैठ रहे थे, हड्डी चटक गई, टट्टी से उठ रहे थे, हड्डी चटक गई. So what advice will you give if bone is fracturing while sitting or standing from Indian toilet? What advice will you give there? The advice you will give is use Nalgonda technique of defluoridation. Remove fluorine from water. And in the Nalgonda technique, we add lime, then alum, then bleaching powder. Three things we add in this sequence: lab, lime, alum, bleaching powder. It will remove extra fluorine. This is the Nalgonda technique of defluoridation. Skeletal fluorosis occur if fluorine is more than 10. Then skeletal fluorosis occur. And what is the normal amount of fluorine in water? Normal amount of fluorine in water is 0.5 to 0.8 millimole per deciliter. This is the normal amount. 0.5 to 0.8 is normal amount of fluorine. It is easy to remember because when it comes to chlorine, chlorine is normal amount is 0.5 to 0.7 in water. And this question has came in last exams that what is residual amount of chlorine? Residual chlorine मतलब वो क्लोरीन जो हमेशा पानी में कम से कम रहना चाहिए बैक्टीरिया को मारने के लिए. Minimum amount of chlorine which should be there is 0.5. And to kill the bacteria, for how many minutes or how many hours we need to put bleaching powder in the water? For 1 hour. So residual chlorine is 0.5 and contact period for killing all the bacteria is 1 hour. And in this 1 hour contact period, which most important ion kill 80-85% bacteria? That is hypochlorous ion, HOCl minus. कैसे याद करोगे? देखो, जिसमें रस है, क्लोरस, जिसमें रस है वही मारेगा सबसे ज्यादा बैक्टीरिया. The one with रस or juice will kill maximum bacteria, and there is one minus, one sode which kill maximum bacteria. So do remember these three questions being asked already, and this is dental fluorosis due to excess of fluorine in water. If there is deficiency of fluorine in water, if the fluorine is less than 0.5, then there will be dental caries, दांत सड़ जाएंगे. So dental caries less, dental fluorosis more, which is shown in that image. Oh, big question, but we can answer it. In all such big question, we are being taught to always read the last line, but the last line itself is not so clear. So let's read the whole of the question and we can do that. I will summarize it. What they are doing is they are trying to understand role of plasma fibrinogen in cardiac event. Okay, increased plasma fibrinogen leading to heart attack. They choose 130 diabetic patient. They followed them for 5 years. So there is a cohort study occurring. And in the group of 60 patient, in this 130 patient, 130 are diabetic. So 130 are the cases which we are following. This is 130 are exposed because it is cohort study. Cohort study is exposed or non-exposed. So this 130 is exposed or diabetic. And we are following them for 5 years. So in the group of 60 patient with normal fibrinogen level, 20 develop acute coronary syndrome and 40 do not develop it. So there is 60 patient. This 60 patient is having normal fibrinogen level, and out of this normal fibrinogen, they are saying 20 developed MI and 40 survived. Okay, out of the normal fibrinogen level. But then there are the other group of 70 people who have raised fibrinogen. So that means this 130 were not exposed. Exposed are this 70 raised fibrinogen. They have something abnormal in their blood. And those people who have something abnormal, they are known as exposed. And these people who have normal fibrinogen, they are non-exposed. Non-exposed without the risk factor. Without risk factor. So in this 70 people, 40 developed MI, 30 do not. So in the exposed, 40 have heart attack. And in the non-exposed, out of 60, 20 have heart attack. So 20 heart attack here, 40 heart attack here, 20 is out of 60 and 40 is out of 70. And they are asking you to calculate relative risk. What is relative risk here? So you can draw a 2 by 2 table to answer such question, but actually we don't need 2 by 2 table here. The simple formula of relative risk is, I hope you all know the definition at least, कि relative risk simply means incidence in exposed by incidence in non-exposed. Incidence in exposed. Exposed means people who have risk factor present, जो कुछ कांड कर रहे हैं या उनमें कुछ गड़बड़ी है, उसमें से कितने को हार्ट अटैक हुआ. तो हमारे एक्सपोज्ड कितने थे? टोटल कितने लोगों को फाइब्रिनोजेन बढ़ा हुआ था? 70 were exposed, and out of 70 exposed, how many have heart attack? 40. So 40 by 70, this is incidence in exposed. Now denominator is incidence in non-exposed. Non-exposed means who have normal fibrinogen or no risk factor here. So non-exposed were how many people total? Non-exposed were total 60 people, and out of the 60, how many had heart attack? 20. So this is the formula of relative risk, definition of relative risk, incidence in exposed by incidence in non-exposed. And mostly when they give exam numerical, they put both 70-70 or both 60-60. They put exposed, non-exposed equal. But here they are unequal. But this will be the answer. 40 developed it out of 70 exposed, and 20 developed heart attack out of 60 non-exposed. So what is the relative risk? Relative risk is 40 by 70 divided by 20 by 60. If you try to solve it, answer will come different. But the option that they have given is based on this thing. Is it 40 by 40 by 20 by 30? Or is it 40 by 70 by 20 by 60? What is the answer? So, acha, this cross, sorry, this star sign is the multiplication sign. So, is it 40 into 40 by 20 into 30? Or is it 40 by 70 by 20 into 60? So, we already got the answer. It is 40 by 70 by 20 by 60. This is the answer coming based on our explanation which I gave. But sometime you can also get this table like thing in the exam, based on which they can give you numerical. They have already given numerical on relative risk by giving you table. So when they give the table, they write disease, and what is the disease here? Heart attack above, and they write exposed and non-exposed here. This side is exposed. Exposed are those with raised fibrinogen level. And how many were exposed? Exposed were 70. How many are non-exposed? Non-exposed are 60. And what is the heart attack which is happening here? Heart attack number is 40 in them, 20 in them. So do remember, this is A, this is B. This is A, B, C and D. है ना? So when we write the formula of relative risk is A by A plus B divided by C plus D. Okay, what is this A plus B here? You can see A plus B is 70. So we will write 70 here. What is A? 40. 40 by 70. And what is C plus D here? How many are non-exposed? C plus D. Non-exposed are 60. And how many have the heart attack? 20. So 20 by 60 will come in the denominator, 40 by 70 in the numerator. This is the answer if exposed, non-exposed are not equal. But usually when they give exam question, then they put both as 70 or both as 60. So if they give, suppose, if both are equal, and like if both are, let's say 100, and suppose exposed, non-exposed, A plus B is also 100. If suppose A plus B is also 100 and C plus D is also 100, if they both are equal, then in this formula, C plus D and A plus B will cancel out. And final formula of relative risk will become A by C. So usually in your exam, when they give the question of relative risk, first thing you have to see is exposed, non-exposed equal or not equal? If they are equal, answer will be just A by C, 40 by 20, 2 will be the answer. And if they are not equal, then this way you will get the answer by calculating it. And if you will want to calculate it, you can. 40 by 70 will remain there, 20, 60 go above, so it will be 60 by 20, 20 will cut 40 by 2, 2 into 60 is 120 by 70, or 12 by 7. 12 by 7 is roughly 80% or something like that, but 12 by 7 will come. But do remember, mostly when they give this numerical in exam, they will put exposed, non-exposed both equal, like 100, 100, and then you just have to do A by C, relative risk will come. And if they are both 100, 100 equal, then the formula of attributable risk will be A minus C by A into 100, and you will get attributable risk. I hope you should know and remember the definition of attributable risk also. What is the definition of attributable risk? Attributable risk is incidence in exposed minus incidence in non-exposed by incidence in exposed into 100. And if you have to remember the formula of population attributable risk, you just have to put population in place of exposed. Non-exposed will remain the same. What is the definition of PAR? Incidence in population minus incidence in non-exposed by incidence in population into 100. So what is the difference in AR and PAR formula? Only difference is, in place of exposed, two places, you change it with population, and AR become PAR. Okay, so do remember the definitions. They many a time ask the definition, which one is correct. Sometimes they can ask numerical. Numerical is either done by the formula A by C for relative risk, or A minus C by A into 100 for attributable risk. And these two formula you will apply if exposed, non-exposed both are equal. If they are not equal, you will apply this big formula of relative risk. Okay, chalo. Next question is that in an exam, in a study, we are talking about of babies born with neural tube defect. So why neural tube defect occur? Because of the thalidomide drug exposure in the past. During pregnancy, you took thalidomide drug, that will lead to phocomelia, not neural tube defect. Neural tube defect can occur due to any drug which affect organogenesis during pregnancy. So here, how we came to know about it? We ask question about acetoaminophen consumption in the first trimester. And when we are asking question about past, it is which type of study? It is case control study. Only in case control, we ask question about past. And in case control study, the question is, what thing you will get in case control study? Will you get prevalence in case control, median survival, relative risk, or odds ratio? I hope you know this answer. Odds ratio, which is also known as cross product ratio. And what is the formula of odds ratio or cross product ratio? The formula is AD by BC. Like in a table, if you write A, B, C, D, in cross product ratio or odds ratio, you are multiplying A with D, B with C. So because you are multiplying in cross way, so this is cross product ratio. Remember, cross product ratio is in case control study, not in cohort, not in cross sectional study. Cross product is not in cross sectional, it is in case control. Prevalence we get in cross sectional study. So if it is cross sectional study, the other name of cross sectional study is prevalence study. And relative risk or incidence or AR/PAR, this we get in cohort study. So cohort study give us new case, like when will you have your new boyfriend or new girlfriend? In future or in past? Of course in future, na? And in cohort study we go in future. So cohort study is incidence, relative risk. Case control is odds ratio or cross product ratio. Okay, and cross sectional study is also known as prevalence study. So that is there. Next question is that they are having a case control study, and in that case control study, odds ratio came out 0.7 and confidence interval is 0.5 to 0.8. So the question is very simple. This look like a big question, but if you summarize it, they are just saying one thing, that in any study, if odds ratio is 0.7, What does it mean? What does odds ratio of 0.7 mean? Does it mean that incidence of neural tube is 7 out of 10? Of course not, because odds ratio we detect in case control, and case control do not give incidence न्यू केस. देखो बात सिंपल है, केस कंट्रोल में हम लोग जा रहे हैं पीछे, और इंसिडेंस का मतलब होता है न्यू केस. और हमने अभी भी बात करी कि नए बॉयफ्रेंड गर्लफ्रेंड फ्यूचर में मिलेंगे, नया केस फ्यूचर में मिलेगा. तो इंसिडेंस वी कैन नॉट फाइंड इन केस कंट्रोल स्टडी. सो ऑल दीज ऑप्शंस वेयर दे आर टॉकिंग अबाउट इंसिडेंस इज रॉन्ग, है ना. Odds ratio do not, case control study do not give us incidence or attributable risk. Case control study only give us chance, or how much more risk or chance is there. And if it is 0.7, what does 0.7 means? क्या 0.7 का मतलब होता है 30% लेस रिस्क? क्या और 0.7 का मतलब होता है 70% लेस रिस्क? क्या इसका मतलब होता है 30% मोर रिस्क या 70% मोर रिस्क? So let's understand it with a very simple example. If suppose odds ratio is 0.7, 0.7 मतलब 7 by 10 or 70 by 100. And there was a question on this topic in NEET exam that we are doing a study between green tea drinker and heart attack. And they found that in the green tea drinker, heart attack was 0.85 or 85, and people who are not drinking green tea, non-green tea drinker, they have heart attack, let's say 100. So in this story, which already came in NEET exam, they ask that if relative risk is 0.85, अगर relative risk 0.85 हो जाए तो 0.85 कैसा एसोसिएशन है, बस इतना पूछा था. निगेटिव एसोसिएशन है, पॉजिटिव एसोसिएशन है, या नो एसोसिएशन है. तो आई थिंक आप जानते होंगे कि जब भी ऑड्स रेशियो या रिलेटिव रिस्क एक से कम होता है, तो एक से कम का मतलब होता है निगेटिव या प्रोटेक्टिव एसोसिएशन. whenever odds ratio or relative risk is less than 1 means negative association or protective association. निगेटिव या प्रोटेक्टिव. तो व्हाट डू यू मीन बाय निगेटिव और प्रोटेक्टिव एसोसिएशन? सीधी सी बात है, निगेटिव और प्रोटेक्टिव मींस अगर आप ग्रीन टी ज्यादा पिएंगे तो हार्ट अटैक कम होगा. निगेटिव और प्रोटेक्टिव मींस इफ यू ड्रिंक मोर ग्रीन टी, हार्ट अटैक विल बी लेस. एंड इफ इट इज लेस देन 1, इट इज निगेटिव और प्रोटेक्टिव. सो व्हेन इट कम 0.7, 0.7 means what? 30% less risk or 70% less? Because it is less risk, it is negative. But how much less? 30% less or 70% less? So देखो 0.7 का मतलब क्या हुआ? 0.7 you can write as 7 by 10 or 70 by 100. And 70 is how much less than 100? 70 is 30 less than 100. So when we write 0.7, 0.7 means 30% less risk. ये थोड़ा इंटेलिजेंट सा क्वेश्चन है, थोड़ा ट्रिकी है, बट आई होप आप ये दो एग्जांपल से इसको समझ पाएंगे. यहां देखो, हमने बात किया कि हरी चाय पीने वाले में हार्ट अटैक 85 लोगों को आया, और जो लोग हरी चाय नहीं पी रहे थे उसमें हार्ट अटैक 100 लोगों को आया. तो 85 100 से कितना कम है? 85 100 से 15 कम है. यानी 0.85 जब होगा रिलेटिव रिस्क, तो रिलेटिव रिस्क 0.85 का मतलब 85% कम रिस्क नहीं है. 0.85 का मतलब है 15% लेस रिस्क. ओके ना? आर यू गेटिंग इट? What I was saying in Hindi was, here 85 people are getting heart attack in those group who are drinking green tea, and 100 people are getting heart attack in those group which are not drinking green tea. So the 85 by 100 result will come 0.85. And how much less is 85 as compared to 100? 85 is 15% less than 100. So when relative risk is 0.85, 0.85 means 15% less risk. Similarly, when it is 0.7, 0.7 means 70 by 100. And how much less is 70 from 100? 70 is 30% less than 100. So when they write 0.7, 0.7 means 30% less risk among people who take folic acid. So 30% less if it is 0.7, not 70% less. And I hope it is clear, and I hope you will remember, if relative risk odds ratio is less than 1 means negative or protective association. Okay, chalo. Now the next question is, in a test you took 400 student and mean score was 60. So mean score is 60, total student was 400, standard deviation is given as 10. Question is, if it is a normally distributed curve, how many student score greater than 80? 80 से ज्यादा कितने बच्चों का स्कोर आया? So whenever they ask how many student scored more than this, more than that, first step you have to do is find 95% confidence interval. And the formula for 95% confidence interval is mean plus minus 2 standard deviation. What is the mean value here? Mean value is 60. What is the standard deviation? 10. So 60 plus minus 2 into 10. 2 into 10 is 20. 60 plus minus 20. How much it become? 40 to 80. 95% student are between 40 to 80. Question is, how many student are more than 80? 95% are 40 to 80. How many are more than 80? This you have to answer. Tell me. Is 10 student more than 80? Is 25 student more than 80? Is 50 student more than 80? Or is 200 student more than 80? So how much was the total student? Total 400 student was there. Total 400 student. And we just got, this is a very tricky question. Only student who are paying attention and interested, they can answer. But this tricky question has came in past and is expected to repeat, because this paper I am expecting it to be a tough. So this type of question is definitely something which can come. Very tricky question. They are saying 60 is the average marks, and between 40 and 80, in this whole yellow area, 95% students are inside it. Okay. So if 95% are inside it, how many are outside 80? कितने बच्चे बाहर बच गए? अगर अंदर में 95 हैं तो बाहर कितने बचे? It's quite obvious. 100 minus 95 is 5%. But does that 5% goes only on one side? क्या 5% एक साइड में हो जाएंगे? नहीं ना. 5% जो बच्चे बच गए हैं उसमें से 2.5% इस साइड होंगे, 2.5% इस साइड होंगे. We will divide that remaining 5% as 2.5 and 2.5%. So how many will score more than 80? 2.5% score more than 80. And what is 2.5% of 400? 400 का 2.5% कितना होगा? 1% of 400 is 4. 2% of 400 is 8. And 2.5% of 400 is 10. So answer is 10. You can do it yourself. 2.5% means 2.5 by 100 into 400. 0 will cancel out. 2.5 into 4, it will come 10. So do remember this thing, that only 2.5% are outside it. Outside plus 2 standard deviation. Okay. So sometime they trick you with this question. They will ask, where are 5% student in this class? 2.5% student are at 40. If they ask where is 5% student, 5% student will be somewhere just above 40. Suppose above 40 it is 43. So between 43 and 40 we can expect 2.5% more student. And now how many are below 43? 5. मैं क्या कह रहा हूं इंग्लिश में कि अगर उन्होंने पूछा कि किस नंबर 5% बच्चे इस क्लास के कितने नंबर से नीचे होंगे, तो आप आंसर 40 मत कर देना, क्योंकि 40 के नीचे सिर्फ 2.5% है. अगर पूछा 5% बच्चे कहां होंगे, तो आपको 40 से थोड़ा ऊपर जाना होगा, तब 5% बच्चे आएंगे. समझ रहे हो? यानी what I'm saying is 5% student या 5% population कहां होती है, lies just above -2 standard deviation. If -2 standard deviation is at 40, 5% will be just above 40, 43. So 5% is just above -2 standard deviation. And outside +2, we have only 2.5%, not 5%. Okay, so this two tricky question can come. I hope you understood it and you can answer it. If not, feel free to ask it in the chat box. I will be more than happy to reply your answer. Okay. Chalo. So, yes, very good. This is again a big question, but in big question, we need not to be worried. Just go through the conversation, because in NEET UG this time a lot of big question came. So we can expect this type of question in NEET PG. Let's go through it patiently. The question is, we are doing a screening test, and in United States, gastric cancer is 7.2%, and positive predictive value is 70%, negative predictive value is 95%. Let's come to the last line. The last line is, the test is repeated in Japan, and in the Japan, gastric cancer is 4 times more. So if some disease is 4 times more in Japan as compared to America, which of the following will occur? Sensitivity, specificity, PPV, NPV, what will be the effect on these 4 things? What is the question asking? The question is just asking that if prevalence matlab total case, old plus new case, if prevalence become 4 times, what will be the effect on sensitivity, specificity, PPV, NPV? So I hope you might have gone through this PYQ where they say positive predictive value is directly proportional to prevalence, but sensitivity, specificity, they are fixed for a test. They are not affected by prevalence. Okay, sensitivity, specificity depend ki which marker we are using, how we are doing the test and all, but positive predictive value depend on prevalence. So if prevalence become 4 times, which one will increase? PPV will increase. So the answer is option C. If it becomes prevalence become 4 times, because we know in Japan gastric cancer is 4 times more. So 4 times more, prevalence is 4 times more, prevalence is 4 times more, PPV become 4 times more. So positive predictive value will increase. Okay, that is the answer of that question. Chalo, next question is, let's go to the last line directly. Which of the following advantage will the randomized trial have over other study? What is the advantage of RCT they are asking? Simple. Just go to the last line, answer will come. What is the advantage of randomization? Randomization is done to decrease confounding. The purpose of randomization is to decrease confounding and selection bias. Chalo, let me explain this two things to you. What is confounding, what is selection bias, with a very simple example. Suppose in your batch, there is a student Sahitya who took Ops and Gynae. And after taking Ops and Gynae, he got a funding from a big organization which say that if you prove that OCP decrease breast cancer, we will give you 1 crore rupees. And now when Sahitya has to prove that OCP decrease breast cancer, he connected a PSM person and said, I will give you 20,000 rupees, prove it. So what I will say to Dr. Sahitya is, in the OCP user group, took those female who are between 20 to 35 year age. And in the OCP non-user group, took those female who are between 35 to 60 year. And automatically, you are here trying to know which will have more breast cancer. So because 35 to 60 year are older, due to old age, this group will have more breast cancer. And if one group will have more breast cancer, automatically, as compared to this group, OCP group will have less breast cancer. And we will forcefully prove that OCP lower breast cancer because now it has less breast cancer. Okay. So in this study, what I am saying Dr. Sahitya to do is to take young people here, old people here. That means we are selecting two different type of group, young and old. Whenever you select two different type of people, this is known as selection bias. Selecting wrongly, selection bias. And how can you remove selection bias? If you want to remove selection bias, best method is that don't select anyone. Like, if I want to lose weight, best method is don't eat. So similarly, if you are selecting wrong people and you are doing mistake in that, don't select. And how you will not select? If you will ask all the participant, all the female, to come and randomly choose from chit. Whoever choose chit A got OCP user group. Whoever choose chit B got OCP non-user group. Okay. So if they are randomly going, we are not selecting anyone. They are randomly going. And if they are randomly going, then young people and old people will get mixed. अब क्या होगा, जब चिट चूज करके जाएंगे तो ऐसा नहीं होगा कि जवान एक में चले गए, बूढ़े दूसरे में. जवान बूढ़े मिक्स हो जाएंगे और इस उम्र का जो अंतर था, सिलेक्शन में जो गलती थी, वो गायब हो जाएगी. If we will ask them to choose randomly, young and old will get mixed and selection bias will go away. So it is removed by, first method of removing selection bias is randomization. It is removed by randomization. Second method of removing selection bias is matching. Matching का क्या मतलब होता है? If you are in the OCP user group, you are giving OCP to a person who is 38-year female. In the non-OCP also, you will give OCP to 38-year female. This is matching. मैचिंग मतलब लगभग एक जैसे लोगों को दोनों साइड में लेना. अगर इधर 38 साल की फीमेल है तो उधर भी 38 साल की फीमेल. मैचिंग मींस चूजिंग comparatively similar people in both sides, like 38. So if you choose both sides same age, again different age group will not be there and selection bias will go away. So how do selection bias go away? By randomization and matching. Okay. Now what is confounder? देखो, confounder is something which is related to exposure and outcome both. And in this story, जैसे एक एग्जांपल से मैं आपको समझाता हूं कन्फाउंडर क्या होता है. जैसे मान लो, सपोज ए बॉय प्रपोज्ड एंड सपोज द गर्ल एक्सेप्टेड. Okay, let's have happy ending here. Now this boy proposal was the reason, exposure, ये कारण था. और गर्ल एक्सेप्टेड द प्रपोजल, दिस इज द आउटकम, ये परिणाम था, है ना. बॉय प्रपोजल वाज रीजन एंड गर्ल एक्सेप्टेंस वाज द आउटकम और द इफेक्ट. अब इस स्टोरी में आते हैं कॉमन फ्रेंड. कॉमन फ्रेंड मीन्स बीच वाले, पीपल हु नो बोथ बॉय एंड गर्ल. सो दे विल से समथिंग टू बॉय एंड गर्ल विच कैन मेक देम come together or break up. So this type of thing which is external and related to both exposure outcome, we call this type of thing as confounder. तो confounder कौन होते हैं? confounder वो होते हैं जो exposure outcome दोनों से जुड़े होते हैं और दो ग्रुप में unequal बटे हुए होते हैं. Confounder are unequal in the two group and related to exposure outcome both, and they are external factor. They do not come in causal pathway. अब इसी स्टोरी में कुछ ऐसे भी होंगे जो ओनली गर्ल्स को जानते होंगे, ओनली गर्लफ्रेंड. दे डोंट नो एनीथिंग अबाउट बॉय. दे विल से समथिंग टू गर्ल which will accept or break the relationship, है ना? Like they will say कि I have seen your boy roaming around with other girl and you also roam around with other boy, so you will be good together, है ना? Like that they will say something which will make their story or something. So this type of thing is known as effect modifier. Effect modifier are those things which is related only to outcome, not to exposure. Only related to outcome is effect modifier. Okay, so I hope confounder effect modifier is clear. And in our story of OCP and breast cancer, this young age, you can see young age is related to OCP user whom we are giving OCP to young people, and due to young people breast cancer is less. So in this story, OCP user are the exposure and less breast cancer is the outcome. And young age is related to exposure also. Young age is related to outcome also. So young age is the confounder here. And in this side, old age is the confounder. So age is the confounder. उम्र कारण से भी जुड़ी है, परिणाम से भी, तो उम्र confounder है. Age is the confounder because it is related to exposure and outcome both. And you can see here one side is young age, one side is old. That means confounder is not equal. Confounder is unequal. One side young, one side old. So confounder is always unequal in two group. Will you remember it? 2 times asked question in NEET exam. Do remember, confounder is unequal. Now the question is, how will you remove the confounder? कैसे confounder को हटाओगे? Again, by the same two method we can remove confounder. First is, don't choose them, ask them to choose randomly. Confounder will go away. Second thing, if you are giving OCP to 38-year female, give non-OCP also to 38-year female. So also young and old age will not be there. Everyone will be get mixed. And if young and old age is not there, confounder will also go away. So you can remove selection bias by randomization and matching. And you can also remove confounder. Confounder and selection bias, both removed by randomization and matching. अगर हमने randomly choose किया तो young और old age मिल जाएगा और ना तो confounder रहेगा ना तो selection bias. उसी तरह से हमने एक एक को मैच करके अगर दोनों ग्रुप में डाला तो ना तो सिलेक्शन करने में गलती होगी, ना तो जवान और बूढ़े अलग अलग होंगे, मिक्स हो जाएंगे. तो कंफाउंडर और सिलेक्शन बायस दोनों चला जाएगा रैंडमाइजेशन और मैचिंग से. I hope it is clear that randomization and matching, they remove confounder also, they remove selection bias also. And I hope you will remember, confounder is related to exposure outcome both, and confounder is unequal in the two group. It is never equal. Okay. So when you do randomization, by doing randomization, this was the question, that if I do randomization in RCT, what will be the effect? Randomization will decrease confounding and it will also decrease selection bias. So that is why RCT is better than cohort, because RCT have no confounder, no selection bias. Okay. Chalo. Now, next question is that we are applying two tests, test A and test B. And if you are applying first test A, then test B. Okay. And this part, first part, is telling us about the sensitivity. The second part is telling about the specificity. Okay. So if you are doing one test and then you are doing another test, which sequence you will choose out of A, B, C, D? Which should be test A, which should be test B? Okay. So I hope this is the question. Let me read the last line first. The question is, in a local community laboratory, 4 available rapid screening tests for influenza was available. All tests provide immediate result and have been done in 24 hours. Now they have given a table and they have written test sensitivity and specificity. So which test sensitivity and specificity order will you choose for doing the test? तो देखो सीधी सी बात क्या है कि we all know that when we do first test, like in case of HIV, first test is ELISA and second test is Western blot. And why we do ELISA first and Western blot after ELISA? Because ELISA has more sensitivity and Western blot has more specificity. So first we try to include more people and then we try to exclude those people who are wrongly included. देखो सेंसिटिविटी का मतलब होता है कि आपने कितने लोगों को पकड़ा, इंक्लूड किया, एबिलिटी टू इंक्लूड. जैसे देखो हम कहते भी हैं ना कि अरे ये दोस्त बड़ा सेंसिटिव है यानी ये कोई भी इसको किसी भी क्लास में किसी का भी ब्रेकअप हो ये अपना कंधा उसको देता है और मदद करता है रोने में, ब्रेकअप से गुजरने में, है ना. तो सेंसिटिविटी का मतलब होता है पकड़ना, इंक्लूड करना. और इलाइजा हम इसीलिए पहले करते हैं क्योंकि इलाइजा की सेंसिटिविटी ज्यादा है. वो ज्यादा से ज्यादा लोगों को इलाइजा में पॉजिटिव ले लेंगे. और अब हम ज्यादा से ज्यादा लोगों को अगर पॉजिटिव लेंगे तो कुछ लोग गलती से भी आ जाएंगे. उनको बाहर निकालने के लिए हम दूसरा टेस्ट जो रखते हैं वो ज्यादा स्पेसिफिक रखते हैं, क्योंकि स्पेसिफिक का मतलब बाहर निकालना, है ना. जैसे आपके बैच में स्पेसिफिक कौन सी बंदी होगी? जिसको कोरियन बंदे पसंद हैं और कोई नहीं, सिर्फ कोरिया के ही बंदे पसंद आ रहे हैं. स्पेसिफिक है वो बिल्कुल, है ना. तो स्पेसिफिक मतलब वो सबको निकाल के बाहर कर रही है अपने चॉइस से, है ना. स्पेसिफिसिटी इज एबिलिटी टू एक्सक्लूड. एंड व्हाई वी डू ELISA first and Western blot second? Because ELISA will include many people, and if we include many people, some are false positive which will be included, गलती से आ जाएंगे. So the second test will remove those who wrongly included, who are false positive. They will be removed by second test. So always we want sensitivity high in first and specificity high in second. So if we are talking about sensitivity, sensitivity high is the first criteria, which is in case A 90. So first test जो होगा, first test always have high sensitivity. That why the answer is 90 and 50, because first thing we want is to include many people. अगर पकड़ेंगे ही नहीं तो फिर हम निकालेंगे क्या? अगर हमने 45, 50 या 25 रखा, यानी 45, 50 और 25 means out of 100 people who have disease, only 45 are included. Out of 100 people who have disease, only 50 are included. If this less people are included, then this test will not be able to include even 50% people who have disease. So this will be a useless test. So the test should have high sensitivity. Then we look on the specificity. So when we are doing two tests one after another, first test should have high sensitivity, second test should have more specificity. And if we are doing two tests like this, this is known as test in series. Pehla test, dusra test. And if both is positive, then we say the person is having the disease. Like you understand, this is known as test in series. And whenever we do test in series, first test should have high sensitivity. Okay? Next question is, that is all based on a table. The data of that table was missed during printing. So that's why I am not able to tell you about those sequence and this question. But let me explain you this two tests which they ask again and again. The two test in series, test in parallel question come again and again. Test in series means, and there is a very useful way of remembering these things. They ask this question that in which thing sensitivity increase, specificity increase, and this is very confusing under exam pressure. So let me just summarize test in series, test in parallel very quickly. If I am doing ELISA first, Suppose I went to party with 199 sex worker after taking this class, and in that party, out of that 200, 20 came positive for ELISA. Guess where I am? And in the positive side. And then all the 20 people went for Western blot, the second test. And in the second test, only 5 came positive. Guess where I am? And in this 5 people, of course. So this 5 are true positive. They definitely have ELISA. They definitely have HIV because they are positive on both ELISA and Western blot. So this is test in series. Now, when we do test in series, what happened to that 15 people? Here it was 20, here it is only 5. So what about remaining 15 people? Those 15 people were false positive. ये 15 लोग गलती से ELISA में पॉजिटिव आ गए थे. These 15 they wrongly came positive on ELISA, and when we do test in series removed false positive. Remove false positive. And when you are removing people, you are excluding people. So when you remove people, removing false positive means specificity will increase. Specificity increases. So do remember, when we do test in series, specificity will increase. And there is an association. This simple formula can help you in telling about other thing. I hope you know sensitivity and specificity are inversely proportional. So if specificity increase, sensitivity will decrease. But there is one more association. Sensitivity is also inversely proportional to positive predictive value. So if specificity increase, PPV will also increase. And I hope you know PPV is inversely proportional to NPV. So NPV will decrease. So if you know only one line ki test in series specificity increase, you can tell about other thing with this interconvertible formula. But what is test in parallel? Let's understand that also with a very simple example. Suppose 200 obese people went for lipid profile testing. And when 200 obese people went for lipid profile, in lipid profile, they do 2-3 tests together. This is test in parallel. First, they will do LDL, anyone more than LDL 100 is positive. Then triglyceride, anyone more than 150 is positive. Then total cholesterol more than 200, anyone positive. And it is very much expected that out of 200 obese, something will be raised in everyone. So all 200 will come positive. So here 200 came positive. So that means when you do test in parallel, you include people. You try to make all of them positive. And that is why 80% test which doctor write is test in parallel. We write LFT, RFT, CBC, all of them are test in parallel. So test in parallel include people. That means test in parallel sensitivity increases, and if sensitivity increases, specificity decreases because they are inversely proportional. So this is test in series, test in parallel, but how will you recall the things under exam pressure? So to recall the thing under exam pressure, you can use a simple line which was told to me by Dr. Rakib in Kagma कि पी पी के गिर पड़ा. पी पी के गिर पड़ा. पी पी के गिर पड़ा मतलब आप जानते हो दारू ज्यादा पी लिया, पी पी के गिर पड़ा. पी से होता है टेस्ट इन पैरेलल. ओके. दूसरा पी है स्पेसिफिसिटी, और गिर पड़ा का मतलब आप जानते हो फॉल डाउन. फॉल डाउन का मतलब डिक्रीज है ना, फॉल डाउन और डिक्रीज. तो अगर आपको ये लाइन याद है पी पी के गिर पड़ा, तो आप ये आसानी से याद रख सकते हो. इफ यू रिमेंबर दिस लाइन पी पी के गिर पड़ा मींस आफ्टर ड्रिंकिंग टू मच फॉल डाउन ऑकर. So you can easily remember that test in parallel specificity decreases. And if you know specificity decreases in test in parallel, then with the help of this small formula that sensitivity inversely proportional to specificity inversely proportional to PPV, and PPV inversely proportional to NPV, you can tell about all other thing. In test in parallel, specificity decreases, so sensitivity will increase, PPV will decrease, and NPV will increase. With this interconversion formula, you can answer other thing. So this will help you to summarize test in series, test in parallel. Okay, chalo. So this was the theory which I wanted to give you here. Then one more question that they are asking is, sometimes they ask the question from the graph type of question in sensitivity and specificity. The graph type of question is, let's say you are doing fasting blood sugar testing of some student and some general population. In the fasting blood sugar, we all know 126 is the cutoff. If someone has more than 126 fasting blood sugar, this side is positive or diabetic, and less than 126 like 110 or 100 or 90, this side is negative. Negative for diabetic, like all of you people are negative for diabetic. And if it is 140, like 140, 160, this is positive. So first thing is, suppose I did a fasting blood sugar of all of you students who are normal. Your curve will come something like this. Most of you will be negative, and you are which type of negative? True negative, because you are non-diabetic and you are negative also. But suppose in the night you did a party with lots of beer and biryani. So in the morning, if I will test you, some of you will come false positive. Some of you will have sugar between 126 to 140, but you actually are not diabetic. So this side is false positive. And then if I do blood sugar of diabetic people like my mother and all, the curve will be something like this. They are all diabetic positive. So which type of positive is this side? True positive. But some people like my mother also is taking their medicine regularly. So they are diabetic, but their blood sugar is less than 126. So they are coming negative wrongly. So they are which type of negative? False negative. So one thing they ask is to label it. Which side is true positive, which side is false positive, false negative, like that. And it's very simple to label. On the side of positive, there is both positive, true positive, and false positive. And on the side of negative, there are both negative, true negative, and false negative. So labeling is easy now. But the question they ask from here is that suppose I am decreasing cutoff of fasting blood sugar from 126 to 110. So if I decrease the cutoff from fasting blood sugar, if I decrease the cutoff from 126 to 110, if I decrease the cutoff, then what will happen? So first thing is, if I decrease the cutoff, false negative will decrease, false positive will increase. If I decrease the cutoff, more people will become diabetic. If cutoff decreases, sensitivity will increase, because now more people will come diabetic. Why sensitivity increase? Because false positive increases. False positive increase, so sensitivity increase. That means sensitivity is directly proportional to false positive. This is a controversial line, but let me explain this with a very simple example. In the NEET exam, previously the cutoff was 50 percentile. But then in last 2 years, what our government did was, they said cutoff is 0 percentile. Anyone can take PG exam. If you have money, come and take it. As a result of this, a student who got minus 12 mark got radiology branch in PG. So that student who scored minus 12 and still got PG, he had not prepared. Actually, even his guesswork did not work. तुक्का भी नहीं लगा था उसका, तभी तो -12 आया था. So which type of positive? Still he got radiology. That means his result was positive ना. So which type of positive he was? He was false positive. गलती से एग्जाम पास कर गया, गलती से पॉजिटिव आ गया, that student who got radiology on -12 was false positive. So that means whenever you lower cutoff, many people who did not study, they will also become positive, they will also pass. So whenever cutoff is lowered, if cutoff I am lowering from 126 to 123, cutoff I lowered. So on lowering cutoff, false positive will increase. बिना पढ़े लोग भी पास हो जाएंगे, false positive बढ़ जाएगा अगर हम नीट का cutoff 50 से 0 कर दें तो. So on decreasing cutoff, on lowering cutoff, false positive will increase. And you can easily tell कि if we lower cutoff of NEET from 50 to 0 percentile, more student will pass or less student will pass? Of course, more student will pass. So whenever we lower cutoff, sensitivity increases, more student will pass. ज्यादा लोग include होंगे. More people will pass on included. And remember what I told about sensitivity? Sensitivity is ability to include. The more people is included, that is the sensitivity is increasing. So when you lower cutoff from 126 to 110, sensitivity will increase, more people will pass. And false positive will also increase. Those will also pass who have not studied. That means sensitivity and false positive is directly proportional. Of course, sensitivity is also directly proportional to true positive, but it is also directly proportional to false positive. So this is second type of question which come from here. One question is marking of the graph, which you can do. True positive, true negative, false positive on one side, true negative, false negative on other side. Second question is, if I lower the cutoff, what will happen to sensitivity? It will increase. And what will happen to false positive? That will also increase. Plus, if you know that formula which we just discussed, that sensitivity is inversely proportional to specificity. So if sensitivity will increase, on lowering cutoff, specificity will decrease. And we also know that sensitivity is inversely proportional to PPV. So if you lower cutoff, sensitivity increase, PPV decrease. And PPV and NPV are inversely proportional. So when PPV decrease, NPV will increase. So like that, if you know one thing, that on lowering cutoff, more people will include, sensitivity increase, you can tell about all other thing. आपको बस इतना सा पता होना चाहिए कि नीट का कट ऑफ कम किया तो ज्यादा लोग पास हुए यानी सेंसिटिविटी बढ़ी, और अगर सेंसिटिविटी बढ़ी है तो स्पेसिफिसिटी कम हो जाएगी, पीपीवी कम हो जाएगी, क्योंकि सेंसिटिविटी से स्पेसिफिसिटी और पीपीवी दोनों इनवर्सली प्रोपोर्शनल है. तो एक चीज का पता हो तो बाकी सारा पता लगा सकते हैं. So these are the two tough question based on graph which you can easily understand and easily answer. Okay, so these are some of the question which I wanted to discuss till this point. Then the last question in this discussion was that standardized mortality rate. How will you explain about standardized mortality rate? What is SMR? So the formula of SMR is observed by expected. Standardized mortality rate is observed death by expected death into 100. What is this standardized mortality rate? Suppose you want to help doctors, that let's say corona like condition came, then there is no insurance that our parent or our family member will get good facility. But government, when what they did during last COVID was that all the Supreme Court judges and their relatives, they were getting Asoka Hotel reservation, that if anybody of the Supreme Court member family will fall ill, in Asoka Hotel they will get the treatment, and doctors from AIIMS and Safdarjung will go there and treat them. So they were getting those facility. And what was done for doctors, they spread flowers through helicopter, because flower will be useful if you are alive or if you die. In both cases, flower will be useful. So suppose you thought that the same facilities should also be given to doctors and their family if some next pandemic came. So you want to get fund for that. Now, how will you get fund for that? One way is you collect the data by calling all the hospital of Delhi, that how much doctors between 30 to 35 years died during COVID 1 year. So this is the data which you observed. You call the hospital and collected the data. And suppose you got the data that out of 1,000 doctors who are 30 to 35 year, suppose out of this 1,000 doctor, let's say 20 died. So 20 died out of 1,000 30 to 35 year doctor. This is your observed death. You observed it and collected the data. आपने फोन करके ऑब्जर्व करके ये डेटा निकाला कि 1000 में से 20 डॉक्टर मर गए. This is your observed death. And what is the expected death? Expected death is the national data. In the national data, we know कि normal Indian between 30 to 35 year, in them 2 deaths per 1,000 occur. 2 deaths per 1,000. So what is the expected death? Expected is 2 out of 1,000. And what is the observed death? 20 per 1,000. So this is the formula of standardized mortality rate observed by expected into 100. With this data, you can go to the government and you can say, ki, look, Mr. Prime Minister or Mr. Chief Minister, the observed death is 20, expected death is 2. That means standardized mortality rate is 10 into 100, 1,000 times more in doctors as compared to general Indian. So kindly give us also some fund so that we can save life of frontline fighter, doctors, family and doctors also. So this is the use of standardized mortality rate. It can help us to get fund for those small population in which death rate are high, like doctor population, which is a small non-standardized population where death rate is high. And we are comparing observed death with expected death of normal Indian and multiplying by 100. This is SMR. So what is the formula of SMR? SMR means percentage of total death that occur in a population to the death which is expected to occur. So observed by expected into 100, this is a standardized mortality rate, and it can help us to get fund for any small population where death rate is high. By comparing them with the national data, expected data, we can get the fund for them. Okay, so this is SMR, and I hope you will remember this formula. Of course, there are many important more topics in NEET exam, and this session I have took a lot of questions which were which were from the tough topics, confusing topics. But I will take one more session for NEET exam in which I will try to prepare a guest paper by giving a specific 50 question. So one more session I will take before your 3rd August NEET exam. But till then, in this session here, if you have any doubt, any question regarding any confusing concept or any tough concept I discuss, feel free, ask it on my number which I gave, or ask it on PW Meded Telegram group. Join and ask question, and I will answer it on the same day, probably 99.99% if I stay alive. So I hope this session is useful. Let's see you in the next session. Till then, hasta la vista, das vidania, bye bye. Thank you so much.